minutes and 20 seconds away from getting started. For those of you who are joining from the conference website, or whether you're on YouTube or anywhere else, do let us know. We're keeping an eye on your comments and we'll be sharing them here. We're here in the Geneva Learning Foundation Zoom studio. We're 1 minute and 55 seconds away from getting started. So, all right, here we have already Major Macdra, who says, good morning to everyone. And do not hesitate. Let's see who else do we have? Jesupe Miwale Adeniji from Oyo Ekiti State, Nigeria, John Gate Development and Empowerment Foundation, Carl Gwe and Juafai, medical epidemiologist from Africa, CDC. All right, we're going to stop. We could do a lot more intros, but I do want to already steer you to the program. We're 1 minute, 15 seconds away, so you can see the conference is now live. If you haven't seen this website, you're missing out. This is where the conference is actually going to happen, and you can see that in 1 minute, what we're going to be starting is the warm-up for Teach to Reach Connect. This is where you'll get to meet participants in the plenary room. And I'm here, of course, with Charlotte Mbu and Maria Fernanda Manzan for the very first time is with us as part of the organizing team, but this is actually her 11th Teach to Reach, and we'll be explaining how that is possible, given the that this is officially Teach to Reach 10. Right, a warm welcome to you from Geneva, Switzerland. I'm here with Charlotte Mbu and Maria Fernanda Manzan. This time it's a trio for Teach to Reach 10. Charlotte, how are you doing? And then we'll go to Maria, who's calling in. She's going to tell you what time it is, where she is calling in from. But first, Charlotte, where are you calling from? And how are you feeling about today's Teach to Reach?
Thank you, Reda. And hello, everyone. Warm welcome to Teach to Reach 10. I am Charlotte Mbu, and I am joining from Ebolova in Cameroon. And it's a real pleasure for me to be participating at this major event. That's the largest community of health workers from around the world. And I'm really excited to listening, to reading, and to connecting with you all. Maria?
Thank you, Charlotte. Thank you, Rita. This is Maria Monzon. I'm joining from Corrientes, Argentina. It's 4 a.m. over here, but I'm very excited about being here, joining all of you, and looking forward to an amazing day at Teach to Reach. Thank you.
All right, wonderful. Thank you very much indeed, Maria. And here we go. So what's on the agenda today? Well, for that, we have to go to the conference website. And this is on a platform called Ring Central. If you go to the schedule, you'll see here. And if you don't understand what I'm doing right now or how to get there, you're in the right place. This is the warm-up, what we call the warm-up. And you'll see it'll be for 15 minutes before we go into a tutorial. How does Teach to Reach work? Unfortunately, this schedule is a little bit unwieldy. Let me see if I can. No, there's just no way to get it to display properly. So, yeah, what we're doing in this warm-up is discovering Teach to Reach. This is especially important if it's your first time. And we're going to meet some of the participants in the plenary room. I'm going to show you where that is. You can see here that it says the time and it says the stage. So where is that exactly? Well, you first need to register or sign in. I'm first going to show you, I'm just going to sign in, assuming that you've come here before. And just to show you what that looks like, this is actually my personal Gmail, and you can see you should have received a Teach to Reach Connect is starting in 59 minutes. And you've also received a message saying, Reda, do you need help? Okay. And this is actually Charlotte reaching out to everyone who just registered asking, do you need help? There is a tutorial that you can watch here. So there's a YouTube link, and maybe we can start there. All right. family, I'm going to show you the 3 essential steps you must complete in order to get the full benefit of meeting, networking, and learning with fellow health professionals. Now, it all starts on the Teach to Reach page, and you can see here, you scroll down to request your invitation. Here, you share your details, so put in your own name. I'm going to put in mine, and then click on request your invitation. If it's the first time you're requesting information, you'll need to first accept, click on the secure link to receive information from the Geneva Learning Foundation. You'll find this on your email. So if I go to my email now, I can see here that I have new messages from T2R, that's Teach to Reach. And the first one is how to access Teach to Reach. And so you need to click to get access. And here we're going to show you what this looks like and the practical steps to actually register on the Ring Central website. This is a service that is giving us the conference platform where you'll be able to meet, network, and learn. So on this page, you can do many different things, but I'm only going to focus on the critical step of registration. Click on Register. And now you'll see this screen loads and you have a number of options on the left. If you are an English-speaking country-based health professional, you just need to click on the first option at the top. You can ignore all the others. If you are bilingual and you're interested in connecting and learning with francophones, this is the option for you. But most of you will choose this very first option. So once it's gray here, you click on continue. You're asked again for your first name, last name, and the email here. Click on register. It will do some processing and then thank you for registering. The important message here is that we sent a confirmation email to the following registrants. Now, we encourage you to share on LinkedIn so you can share the fact that you're participating in Teach to Reach, but the next step also happens on email. And this is where you now see a new message. This one is from Ring Central. And if you scroll down here, you'll want to, it says, thank you for registering to Teach to Reach. The key place, the open sesame that will allow you to enter the event and participate in it is actually at the bottom of this email where you need to click on enter event. So let's try that. If your pop-up windows are blocked, you'll need to activate them as I just did. Here now it is authenticating, and the first thing you'll be asked to do is to complete your profile. So I will put in mine. You can put a bio about you, your company, and then add your social profile. So I'm going to do that. So you'll need to, for example, go to LinkedIn and copy your LinkedIn profile. Go to Twitter. If you don't have those things, then don't worry about it. And then we will save. If you're really in a hurry, you can skip. But because this is really about making connections, I would suggest even uploading your photo and so on. You now click on save. And there you're in. The only thing I haven't done here, which I recommend you do, is actually upload the photo. What can you do here? The event is starting in 1 week. So actually, what you can do at this stage, you can see that the sessions are turned off, but you can see already some people have left messages. So please do introduce yourselves. So this is Reda Satki recording a tutorial for Teach to Reach participants. And here, what you can do is consult the schedule. So you can see here, June 20th, all the sessions are in English. June 21st, all the sessions are in French. So don't get confused. If you look at June 21st and suddenly you start seeing things in a different language, don't worry about it. Here, you can see that there are, you can choose items from the schedule and download the calendar invite. So you can add specific sessions to your calendar. You can also add to your own agenda by clicking on add to my agenda here. And you can go through here, and then once you've added to your agenda the sessions that you've selected, actually I selected a French session here, show up in my agenda, and you can see also which sessions you're going to prioritize. Now for the event, you also have access to the People tab. So this will show you who is participating in the conference. So if I'm interested in connecting with Jonas Kabeya, now Jonas hasn't filled in their profile, but I can invite him to video call, schedule a meeting, or send a message. Of course, I would recommend sending a message first before you start scheduling meetings or inviting to video calls. The part I can show you is the speed networking, and this is the heart and soul of Teach to Reach. It's the best part, and I don't want you to miss it. When you click on Join Now, of course, this is being recorded before the event, so there's no one on now, but if you click on Join, it will ask you for to confirm your audio and video settings, right? Let me see if I can do better than this. No. So yeah. And apply to selection. So you'll select your webcam and your microphone. We recommend in general turning off the webcam, and then you will connect, and you'll be connected with someone else in the conference. You'll have 5 minutes to start the discussion, and you can extend the time if you want more time. So that is the heart and soul. You'll see the stage and the sessions. We'll be showing those off during the warm-up and tutorial that we'll be doing before we open Teach to Reach. So there you go. That's how you get into Teach to Reach. This is how you fully participate. Now, if you are a guest of honor or partner, you may be invited to the Zoom studio, and that is a different option. Of course, the Zoom studio is not on this Ring Central website, but you will use a special Zoom link for those cases. If you don't know what I'm talking about, if you haven't received any invitations that mention the Zoom studio, then you can safely ignore what I just said. But the main place, the best place to participate in Teach to Reach is on this ringcentral.com website. And I've just shown you the 3 critical steps that you need to go through to fully participate. All right, so that's a quick intro for anybody who manages to catch the live stream and sees the tutorial. Hopefully we can rescue a few people who really want to join. Remember, right now we are, let's go back to our schedule. Oops. Let's go back to our schedule. And you can see here we're in the warm-up for Teach to Reach. So really to discover Teach to Reach for the first time, now we're going to turn to folks in the Zoom studio. And then we'll be doing a more explicit tutorial in about 6 minutes or so, really to show you step-by-step, including how to register in Teach to Reach, even though I've kind of already done that. We'll see. Let us know in the comments if there's a need. Let's go now for the very first time to the stage. And this is where most Teach to Reach participants are watching right now this plenary. There is a slight delay, so we can go to the comments here. So we want to wish a warm welcome to Ukamaka Okafor, who says hello everyone. Adesoji Odukoya. Iyad Omar, who says hi colleagues. Ben Rushton says hi to Maria. So he's the founder and CEO from Panadia Diagnostics. Joseph Ngugi from Muranga County, Kenya. Carrie Eller from Atlanta, Georgia, who says she's looking forward to learning from and with you today. Maybe Charlotte and Maria, we can ask for your top tips. And I'd like to start there with Maria. I'm hoping she's not busy with another urgent task. And there's a reason, Maria, why I want to turn to you. You are amongst part of the group that has participated in 11 Teach to Reach events. And can you introduce yourself and tell us, first of all, why you kept participating in Teach to Reach all over the last 3.5 years? And second, what would be your 3 top tips for folks who are participating for the very first time?
Thank you, Rita. Well, good morning, everybody. This is Monson from Argentina. Yes, indeed, this is my 11th time participating at Teach to Reach. I'm a pediatrician, so I work at a primary healthcare center, also with TGLF since this year. So, top tips. Well, first, make sure your audio and is working for the networking sessions, so you can get to take advantage of that and to meet other people, which is amazing. Second, I know that we are all working and it's difficult for us to have a lot of things on our table at the same time, but this is really a day in which take advantage of all our everything that we have prepared for today. Everybody that is going to be speaking to us, that we're going to be meeting, we're going to learn from all of them, and that is really an amazing thing. And third, I would say be prepared to be surprised. There's a lot of things that you would have not thought that it would come up in such an event, but these are really let's say life-changing events. I can tell you, stories some other time when we have more time, or maybe we get to network later today, in which an experience really helps you out. So have fun and enjoy today.
All right, thank you very much indeed, Maria. And now we're going to go to Isha Goyal from India. With this question, she's also a very committed and dedicated Teach to Reach member of the community, and she is going to introduce herself and explain Teach to Reach in one sentence. Isha, are you ready?
Yes. Hi everyone. As a very good morning, good afternoon, or good evening, as per the region from where everybody is joining. And in one sentence, I can explain Teach to Reach is a very good platform to collaborate with each other and to learn with each other. And it's interesting to know the experiences from different countries and to apply them in our area so that we can also improve the work in our areas.
Amazing. Thank you, Isha. And can you tell us a little bit more about yourself? How many Teach to Reach sessions have you joined? And can you think of one thing that really you took away from a session that has helped you in your daily work? Because ultimately, that's what Teach to Reach is about.
Yeah. I was able to join around 6 to 7 times. And the most important thing which I learned from here was from the Nigeria or Kenya, that how they are involving the local people and the community leaders or religious leaders for mobilization of the beneficiaries, because that is the most important step for mobilization of demotivated parents so that they can get their child vaccinated. And ultimately, vaccinating each and every child is the motto of all the people who are working for health or the vaccination platform.
All right, thank you very much indeed, Isha Goyal. And next, we're going to full Maureen Fuen. So I believe traveling from India to Cameroon. Full Maureen, the floor is yours. Do introduce yourself and explain Teach to Reach in one sentence. And then I think Charlotte will have some questions for you.
Thank you very much, Reda. I am Full Maureen Fuen from Cameroon. I serve with a faith-based healthcare organization, the Cameroon Baptist Convention Health Services. I'm the primary healthcare and humanitarian programs lead. And Teach to Reach for me in one sentence is, Teach to Reach is a place where we learn from experience. Thank you.
Wonderful, Full Maureen friend. Can you tell us one thing that you learned from a previous Teach to Reach? That's question one. And question two, what are you expecting? What are you specifically most interested in learning about today?
One thing I learned, I think it was my very Teach to Reach experience, my very first. I learned from, I think it was from a Nigerian colleague, sharing how they are integrating immunization into every activity. And it was so much of an eye-opener to me that I'm intentional about it and have been doing it, and it's been producing a tremendous result. And for today, I'm expecting to learn still something new, especially looking at, because in my context now, there is a crisis, and so immunization and other things are dropping. We have outbreaks often. So I'm looking at maybe today we'll be able to learn something new on how to do it, especially in the context maybe of crisis. Maybe there's a colleague that will share an experience that will be able to help me better my assignment. Thank you.
All right. Thank you very much indeed. All right. Charlotte, I believe next we're going to hear from Ghana with pharmacist Bernard Badu-Bediako. Again, the same question. Do introduce yourself, Bernard, and then tell us if you can give us Teach to Reach in one sentence. But first, do tell us who you are and what you do.
Thank you very much. So my name is Bernard Badu-Bediako. I am a district director of health services with the Ghana Health Service, specifically at Amansia West District Health Directorate. So as the district health director, I advise the district chief executive on all matters relating to health, and I oversee, supervise, and ensure that all approved national health policies on both public health and clinical care are fully implemented. And for that matter, I ensure that universal health coverage is achieved within the district. Thank you very much.
Thank you, Bernard. And so if you had to sum up Teach to Reach in one sentence, can you tell us can you make it fit? Yes. What are you expecting to learn today?
Thank you very much. Teach to Reach is a global platform, and it's a great opportunity to network with other health workers working in other countries and also in country. It's also an opportunity to learn new interventions and ideas. And having learned them, it's expected that you would use them and reach out to everyone, especially my interest always is in the children under 5 when it comes to immunization, so that no child is left out. You have to reach every child. Thank you very much.
Thank you very much indeed. We heard from India, Cameroon, Ghana, many more countries represented in today's sessions. I want to take you now through today's program to give you a sense of what is going to come up, what to expect. Today we've got 10 minutes left in this tutorial. How does Teach to Reach work? So it's important to make sure that everyone can make sense of this event. There is, of course, immunization is on the agenda, as it always has since the beginning. The very first Teach to Reach conference in January 2021 took place at a very particular moment when immunization staff from all over the world were being asked by their governments to introduce this COVID-19 vaccination, a massive, unprecedented effort, and that was the occasion for the very first Teach to Reach conference. Today, the high on the agenda you're going to hear and hear and speak and tell us your experience is, of course, around the front lines of climate change, as well as many other topics that are related, such as malaria and neglected tropical diseases. So let's dig into this program. And so first of all, we're here, but you can see, and hopefully if you go to this, so this is on the Ring Central website. In 10 minutes, we'll be having a first-time event at Teach to Reach, and that is what we call the Teach to Reach Leaders and Partners Forum, championing community-driven learning and action. So this is really a pivotal moment. We open our partnership model to local organizations. We acknowledge their vital role in driving sustainable development. So you're going to hear from a few of the more than 220 leaders of organizations. We're going to share or introduce their organizations and share a story of a success that they've achieved through the work of their organization. And really, we're looking at building and recognizing and building community strengths, cultivating ownership of what happens to a community needs to be decided on by members of the community. So that is coming up in now less than 10 minutes. We're very much looking forward to that. And after that, at 10, we'll be having the opening ceremony. So this is where we're going to really cross over all of the different events that are built into this Teach to Reach, this 10th edition of Teach to Reach. So this is 10 in Geneva. If you go to the schedule on the Teach to Reach application to conference platform, you will see the exact time in your location, just as long as your computer is set in the right time zone. Again, in this, okay, and I just have to mark a pause to celebrate Chigo Ogobuike's message. Is so happy to be participating in a first Teach to Reach. Amazing. Just wanted to take a time out for that. So at the opening ceremony, this is where you're going to hear about all the issues we'll be dealing with, whether it's the issue, say you care about climate change and health, and that's why you're here. You're also going to hear from Women Who Deliver Vaccines Collective. We're going to open Teach to Reach. Charlotte has prepared this with other women from the collective, really sharing their perspective on the intersection of climate change and immunization. We're going to unveil the Teach to Reach HPV vaccination handbook. This is the first time we've done anything like that. You'll see it's very interesting because it is a handbook grounded in the experiences that you and thousands of others shared at previous editions of Teach to Reach, really looking at what works. We'll be looking at covering the other topics, 50 years of the EPI program, and we'll be asking you the Teach to Reach questions, how you've turned learning into action, and what helps you transform learning into results, a significant moment of learning. I only have 7 minutes left. You can go see for yourself what's in the program at the opening ceremony. This is really the moment when we hope everyone will be there. We're sorry for anybody who misses it. Now, an hour later at 11 a.m. in Geneva, 11 in the morning in Geneva, check your local time. So we always have some people get confused by these different times. So here you can see this will be the main climate change and health plenary session. So we'll have Maria Nera from the World Health Organization, who was here last week for a lightning chat, join us, and we'll be hearing from you, turning to you and to our guests of honor who contributed by answering one or more Teach to Reach questions about climate and health, asking you to share your stories, your experiences, so that we can learn from each other. That will be followed by a short networking session. So we'll be taking a pause in the live stream just in order so that everyone can enjoy the networking at Teach to Reach. After that, we'll be going to the first partner showcase. So this is really about ending neglected tropical diseases. And there we'll be asking you to share, inviting you to share experiences of health professionals facing the devastating impact of NTDs like schistosomiasis, lymphatic filariasis, and onchocerciasis, and 18 others, I believe, on individuals and communities. We'll be hearing from you about the innovative strategies, what you're doing that's new and different for NTD prevention, the power of community engagement, locally led solutions, all of those that you have shared ahead of Teach to Reach. So we're really looking forward to that session. But that's not all. Right after the NTD session, we'll be talking about malaria. And there you can see, again, insights, your insights. Teach to Reach is about you. This is not about global experts coming to present. That is also very important, but that is not what we do at Teach to Reach. So here, we'll be looking at, again, asking you to share your experiences. And in the Zoom studio with us will be the guests of honor, those who took the time to answer Teach to Reach questions before that we asked in the weeks counting down to Teach to Reach. Then we have some great, amazing partner showcases with eHealth Africa and EHA clinics. So you can see that here. And that will be in the main plenary. We'll also be inviting them. They'll also be focusing on one tool that eHealth Africa has developed called LOMIS. So you'll be a digital solution to support routine immunization in Nigeria. So we'll be asking them questions about that as well. Going on, because I only have 4 minutes left, as you can see, the program is packed. We'll be going into a session, and this is where you will have to make a decision whether you want to join eHealth Africa and EHA clinics for their first workshop on the integration of primary healthcare into vaccination strategies, or you want to go and network for the second networking session on climate change and health. So networking, I'll show you. You saw briefly in the tutorial how that works. And then finally at 3 p.m. Geneva time, but the time may be different depending on where you are, we'll be having the Humanly Possible EPI at 50 plenary. I want to turn to Maria because Maria is first and foremost a primary healthcare doctor in Corrientes, Argentina. Maria, what are you expecting from this session this afternoon on the 50th anniversary of the expanded program on immunization?
Thank you, Rita. Well, I'm looking forward because this is a very important anniversary that we, everybody working in immunization or in primary health, we do celebrate it. And I'm looking forward to hearing from our guides on the side, Kate O'Brien and Sunera Gilani, that are going to be there, and listening to the experiences from all over the world how you're dealing with challenges with new vaccine introductions. There's a lot going to be happening there. So it is going to be a pretty amazing session.
Awesome, Maria, thank you. And then we have, so with the 3 minutes remaining, I do want to pay attention to the question from Yakaka Al-Haj Bulama, who asks about when we're going to be including a new topic, which in fact we've never discussed before at Teach to Reach. I'll come back to you with that. But first, so the last, I think this is the final, this is the final session. So it won't be in the plenary. So you won't be able to go in the Zoom studio. I'm going to show you, maybe that'll be the last thing to show you. And we'll show you again in plenary later how to get to the sessions, because for that you have to go to the Ring Central Teach to Reach website, and that'll be the Neglected Needs of Women's Health workshop with eHealth Africa and EHA clinics. So you can see some of the distinguished guests that will be leading this workshop, such as Dr. Ifa Nanya Ilodibe, Dr. Zara Isa Modibo, Sei Amao, Dr. Chito Umeni Nanwana, and Dr. Tambari Femi Oluwole. And finally, we'll finish the day with a networking session where, again, networking is the heart and soul of Teach to Reach. I'm going to show you how to navigate a little bit. So if I go all the way back up before we start the Partners and Leaders Forum, again, once you're in, you enter event. And here, there's a number of things you can do. I'm not going to be able to show you everything in 3 minutes. The first thing is you should be here. This is where you will see, this is the main stage. So this is where you'll join the main plenaries that are shown as such as the program. Okay, I love this message. Please, if I join one program, can I get, okay. Okay, and Chinwe Enechuku, a warm welcome to you. She's a registered nurse from Nigeria. Let me see if can I get a recorded version of the other programs? The programs are all interesting, please. So the answer is yes. You don't have to wait either. You can go right in. Let me just go to the Geneva Learning Foundation's YouTube channel, and that is where you'll be able to see instantly the recordings of all the sessions. So that's it for this warm-up and tutorial. So if you're here for the first time, a round of applause for you. We're now going into the Partners and Leaders Forum. All right, a warm welcome to you from Teach to Reach. 10 health workers share experience on the front lines of climate change and health. Many other topics today at Teach to Reach. Let's check where we are in our program, in our schedule. We're now going into what we call the Leaders and Partners Forum, and this is the very first time we are doing it, championing community-driven learning and action. If you want to see who these partners and leaders are, you can go to the conference website, and you can see here we have amongst our global partners UNICEF, NPHCDA for the UNICEF Nigeria Immunization Collaborative, which we'll be introducing in a few minutes. DevX is one of our media partners. I'll also introduce the Gavi Vaccines Work website. You can see a series of articles on Gavi's website about Teach to Reach and really drawing upon the experiences of Teach to Reach participants across a range of topics. We also have the Health Policy Watch as our third media partner. So this is for independent global health reporting, and you'll see that they are featuring Teach to Reach and encouraging global health partners, global health staff at all levels to join Teach to Reach today. So these are some of the global partners together with the Zero Dose Learning Hub, of which the Geneva Learning Foundation is part. And then it gets very interesting. We have a range of partners whose logos you can see here. And the first thing we want to say is to welcome each and every one to the Teach to Reach family. We'll be hearing live from them. If you do not know these any one of these logos, I encourage you to go to the Teach to Reach website, check them out. If they have a website, the website is linked, and I especially want to thank Maria Manzan, who's coordinating all of these global partners. We're then going to go, so these are the partners that are being featured with their logos, but there is a much larger list, and that is where I want to really take the time to go through. So here we go. welcome all these partners to Teach to Reach, and we are going to go through the full list of all of the organizations whose leaders came to Teach to Reach. Some of you for the very first time, not knowing who we were or what we do. Over the last few months, we got to know each other, and today we're very pleased and proud to welcome you to the Teach to Reach family, and to share with you this moment before we turn to those of you who are in the room. If you are a leader of an organization that has become a Teach to Reach partner, please raise your hand so that Charlotte and Maria can identify you. Here we go. These are organizations from all over Africa, Asia, Latin America, Francophone and Anglophone countries. We warmly welcome you to the Teach to Reach family, and we hope that you'll find the experience you have here at Teach to Reach useful to the work of your organizations, and you'll be able to contribute and benefit from it as well. We want to highlight partners eHealth Africa and EHA Clinics, with whom you'll be joining. You'll be invited to join a plenary session and then 2 workshops on really empowering health and empowering communities with data-driven local solutions. We've already had the pleasure of meeting David Akpan, and many of you came to his lightning chat. We also are proud to count amongst our partners uniting to combat neglected tropical diseases. There we had the pleasure of meeting Toko Elfik Puli, who's the Chief Executive Officer, to discuss the relationship between climate change and neglected tropical diseases. So, as you know, Teach to Reach has grown over the last few years, and I'm going to show you exactly how much. So Teach to Reach 6, 12,398 participants. Those of you who've been here since Teach to Reach 6 know we do this every time. Teach to Reach 7, 13,676. Teach to Reach 8, 16,835. Teach to Reach 9, 17,662. And we have the final number for Teach to Reach 10, even though there'll probably be some people joining throughout the day. But as of this morning, believe it or not, there are 21,398 health professionals registered for Teach to Reach 10. Let's go check in, and I want really to thank the organizations that have joined Teach to Reach. Let's go check in on the plenary here. Veronica from Kenya, who's not a medic but founder of a patient support organization. I believe, Veronica, you are amongst the leaders that we're welcoming to the Teach to Reach family today. Now, I'm going to turn to Maria, who's been coordinating these amazing partners and leaders, and we have a number of raised hands in the room. Who shall we hear from first? We have a question for you as a leader. We want to avoid really just hearing you. We're sure you'd like to speak about what your organization, but we have 2 questions for you. One is, how many people are attending Teach to Reach from your organization? Whoops, let me just fix that. And a second question, why did you become a Teach to Reach partner? Maria, over to you. Who shall we hear from first?
Thank you, Rita. Chica Offer, I think you're unmuted already. Go ahead. Don't forget to introduce yourself.
Yes. Teach to Reach. We are the pioneer. We started together. My name is Chica Offer. Can you hear me?
Loud and clear, Chica. A warm welcome to you.
Can you hear me? Okay, my name is Chica Offer. I'm the CEO of Vaccine Network for Disease Control, and I'm happy to say I was here from the very beginning. I am so excited with the numbers. Oh my God. And one of the major reasons that supported me being a partner was I learned a lot. I met many people and I had many ideas and I learned many ideas. And some of the ideas I'm using today in my organization. And guess what? We are flying. We are flying. It's so inspiring. Teach to reach. It's really teaching to reach. And then now I know the world is a global village, truthfully, and it's practical because now I see people from different countries. I'm so excited. I can't stop talking. I feel like jumping. Rada, thank you so much for giving me this opportunity. I don't take it for granted. I've met so many people. I've learned so many things. And oh my God, I became a partner because there's so much to learn. There's so much to give. There's so much networking. There's so many people we have come into contact with. We know the latest trends. We know what is happening. We know where to put our focus. We know how to align what we do with what is happening globally. So I just want to say thank you. And my organization, about 3 people are from my organization that are attending, that registered for Teach to Reach as well. Thank
Wonderful,
you so
Chika.
much.
Thank
I'm
you so much.
grateful to be here.
Great for you to be back. Maria, I'm secretly hoping the next person is joining Teach to Reach for the first time, but whether or not that's the case, we can't wait to hear who's going to tell us next. We're listening to leaders and partners. Over 220 organizations have become Teach to Reach partners. Maria, who are we hearing from next?
Thank you, Rita. Justin Espoir Machongo, I am asking you to unmute. If you can do so you can introduce yourself. Welcome.
Okay, thank you very much for the opportunity. My name is Justin Espoir Machongo. I'm the CEO of a UK-based charity called Stand as One. Stand as One is a non-profit organization working for the advancement of education and community development. We recently ran a project of education program on climate change and environmental crisis in Burundi. I'm so excited to be here today. Thank you very much.
Okay, wonderful, Justin. So how many people are attending from your organization and why did you become a Teach to Reach partner?
3 people have attended this so far, myself and the other 2. And we were inspired because we saw this online and then we said, okay, let's join it straight away to meet other people and make connections. Thank you.
All right, wonderful, Justin. Thank you, and welcome to all three members of your organization. Maria, who's next? I saw that Prajakta Pradeep had, Prajakta Pradeep Shukla.
I'm asking.
Yeah, would you like to introduce yourself and tell us, introduce your organization, tell us why you became a Teach to Reach partner and how many people are attending today from your organization. You saw the reason we showed the numbers is you can see that there's more than almost 4,000 new people who have joined today's Teach to Reach compared to the last one that was held in October 2023. So that's quite a leap. We'd love to hear from you, Prajakta.
Hi, thank you for having me over here. It's a wonderful platform. I just got to know about it from one of the colleagues, and the idea of connecting with the people who are actually working on the ground level, who have their own difficulties and issues. It's so inspiring, and I'm very thankful for the Geneva Learning Foundation for bringing all this on one platform. And I'm sure this is a very tough task. So good job to you guys.
Right.
I work with this is a marvelous, magnificent task that you guys are doing.
Thank you, Prajakta. So my next question for you is then, what are your expectations? What are you hoping to learn by sharing your experience with people who are on the ground in local communities from all over the world and who are connecting today through Teach to Reach?
My expectation is to know more and more about their experiences, their challenges, and how they're overcoming those obstacles. We might be between different landscapes, different countries, but I'm sure as an individual, we are facing the same issues and a big barrier that is the climate change. And it's not the easy journey, but it's good to know that so many people are together in this.
All right. And one last question for you. In your community, remind us where you are exactly. What's the biggest challenge that you face and how does your organization actually help?
Right. So I'm based in Delhi and my organization is called Institute of Grassroots Governance. We work with panchayats. Panchayats is the grassroots organization, the administrative units, who help people, who help the administrators to understand what's happening and how to deal with it. So we are at a very conceptualized stage. We are still designing the programs, but at this point of time, we are trying to aware people. For example, now in Delhi, the heat waves are at the height. We are having temperatures of 52 degrees Celsius, and so many people are getting sick. And they don't even know that it's because of the heat waves. They just feel that they're getting sick because of, dehydrating or something. I mean, they don't have the understanding. So our job is to intervene and tell them that it's a heat wave. Don't step out. If you get sick, drink a lot of, salts and water and keep yourself hydrated. So we are just at the awareness stage, but we look forward to conceptualize and design proper programs.
Very interesting, Prajakta. Did you answer any of the Teach to Reach questions, or did members of your organization do so as well?
From my organization, I'm the only one who look forward to the health vertical. So yeah, it's only me, but in the future, there'll be more people to join from our organization.
Okay. All right, thank you very much indeed. We're meeting some of the leaders and partners. You can see the amazing list by going to the reception on the Teach to Reach website. You can see here. So it's called sponsors, but it's actually partners and sponsors. And you can see the organizations that shared logos and met all the specifications and requirements that Maria Monzon, our partnerships coordinator, had for them are up on the website. If your logo and your organization did not make it this time, you are still a Teach to Reach partner, and we value you as a valued member of the family, and you can be there for Teach to Reach 11, but there's already a very impressive number of organizations here. All right, wonderful. Maria, I'm turning back to you just to hear this time.
Thank you very much.
Yeah.
Sorry?
Go ahead. Who shall we hear from next?
I was gonna ask Farm Bernard Raju to introduce himself. Welcome. I see you're unmuted.
All right, just before Farm Bernard comes back to tell us more, Ali Cisse from Mali, who's a doctor for emergency medical help and humanitarian assistance, says he wants to speak now. He's connecting from YouTube, or he's on the stage in our conference platform. So in that case, let me see. Yeah. So in that case, you can share your comments and questions on YouTube or wherever you may be. We'll be able to bring them in. For example, here is a comment from Adaemo Sunday Charles, who just says hello. He's from Niger. Back to you, Maria.
Thank you. Farm, if you cannot unmute, I'm asking Ulu Felique. Can you unmute? We're having connection issues. Or Justin,
Hello?
it's what? There you go. Go ahead.
Hello?
Please introduce yourself. Yes, we can hear you. Welcome.
Great. Thank you very much. So my name is Farm Bernard Bedu Bediakon. I am the District Director of Health Services of the Ghana Health Service, Amaste West District Health Directorate. And I'm really happy to be part of Teach to Reach 10. I have been a part of Teach to Reach since its inception, and I could recollect.
Did we just lose?
I think we
Farm
lost
Bernard?
you.
Okay, I'm so sorry. And Farm
That's
Bernard.
Reach 5. I was a speaker on COVID-19 vaccine integrated into our routine immunization sessions. And so for me, Teach to Reach has been very, very helpful to me. A lot of great ideas as to how we could ensure zero-dose children in the reaching out to the zero-dose, making sure that every child within the district receives full immunization. And through the networking, I got new ideas from other countries, how they are doing it. And it has really helped us in Amaste West District. And so our immunization coverages are always above 100%. And that has been very, very helpful and remarkable to us as a district.
Thank you very much indeed, Farm Bernard. And I want to highlight that actually there's a very strong presence today from the Ghana Health Service. A number of regional and district level branches of Ghana Health Service have joined. And we recognize when we speak about local organizations that in many cases it is the government services, the government health services that are based in a community. Your mission is to serve community needs, and it's led by community members, and it's accountable to the community served. So in our call for local partners, we realize that there's something very powerful, a kind of alliance between the civil society organizations where people just out of goodwill come together around a specific purpose or mission, and the government whose responsibility it is to respond to health and other needs. Just to clarify for Bwango Benjamin Mukapa, who says he has no option to unmute. So you're in our Zoom studio. You can. We asked you to raise your hand and also type your comment in the chat first, and then we'll come to you. Yes,
his
go
hand
ahead,
is
Charlotte.
now raised and he is on. I just wanted to say his hand is now raised and he's unmuted.
Okay, and I believe we've heard from Bwango Benjamin before in the lightning chat. So yeah, go ahead, Bwango. Why did you become a Teach to Reach partner, and how many people are attending from your organization?
Thank you so much for such a good question. Good morning to everyone. By names of Benjamin Mukapa, logging in from Uganda. I'm the CEO of Village Search Aid Initiative. Actually, 4 of my people from the organization have joined this session. It is a very good session, and I welcome all the collegians. I think there are several reasons as to why Villa wish to become partners with the Reach to Reach 10. First of all is knowledge sharing. By working together, the two organizations could share knowledge, data, insights that benefits both of our efforts. This combination of the ideas and information could be led to the new breathing thoughts. I think next I can talk about is increased impact, combining the Teach to Reach connections and reputations for both organizations could amplify the impacts they are able to have on improving health through education and other initiatives. Maybe to add on, I can talk about expertise in research and innovation. At the Village Search Aid Initiative, Kilekila has expertise conducting research, developing new technologies and approaches, and identifying innovation solutions. This could be valuable for Teach to Reach, and as we all work together to address health-related challenges. That's all I can talk about why to become a partner, Teach to Reach.
Thank you very much indeed. All right, many messages coming in our Zoom studio and also across social media. For example, Joanne Kainiu is a nurse and has been participating in immunization services Teach to Reach. She's not a partner, but she says she's gained hugely in reaching every child in the community. Beatrice Micah Layope, Faces Nigeria, is that the name of your organization? Can you clarify? Hamida Mohammed Yaldu says good morning. Hamida, are you involved in an organization that is a Teach to Reach partner? Let us know. And of course, for organizations, this is an amazing opportunity to connect with partners from all over the world. Back to Maria for our next leader of an organization that has become for the very first time a Teach to Reach partner.
Thank you very much, Rita. I want to invite Fatima Sarah Abubakar Otaru to introduce herself and to tell us about her organization. Fatima, the floor is yours.
Can you hear me?
Loud and clear.
Yes, we can.
Good morning, everyone. Good afternoon, good evening, hello from wherever we all are. My name is Mrs. Fatima Zara Abubakar Otaru. I'm a public health professional, a public health educator, and a senior lecturer at the College of Health Technology in Bauchi State.
All right. And so the question for you, of course, is why did your organization become a Teach to Reach partner?
Well, I've registered I registered to be a member of Teach to Reach since 2020. In fact, I looked through my email and I realized my first mail officially was in December 2020. And I so appreciate Teach to Reach for never giving up on me because every mail that was sent probably to everyone that has ever registered, I received every single one. But obviously, things have been busy one way or the other, and I've never really had the opportunity to participate fully. It's either I will participate, I will listen to come on the meeting once and never attend again. And that's how it's always been. But this year, based on developing in my career field and everything, I was so passionate and so interested in participating in it fully to see, and all the things that, to also reiterate everything that has been said, like all the messages to learn from Teach to Reach, I've always been following it, which has really improved my career field too. It's just I've never physically participated or even ever spoken, yes.
And Fatima, you are part of a university. Are there other, do you have colleagues and students who are joining?
A college of health technology, not university.
Okay, College of Health Technology, yes. And so do you have colleagues and students who are participating today?
Yeah, I sent the invitation to most of my colleagues, which I'm not certain if they registered, but I am practically the representative of the institution. Yes, I am the representative of the institution to participate.
Wonderful.
Yes.
All right. So a warm welcome to you, to the Teach to Reach family. Again, we're honoring what we call local organizations that are based in a community, that are serving a community. That is the mission, that are led by community members, accountable to the community served. And at Teach to Reach, we recognize and welcome organizations that are private, such as non-governmental organizations or civil society organizations, as well as public, local government, health services in particular, have very strongly been participants in Teach to Reach since the beginning. Today is the 10th edition and continue to be an important source of health and support for local communities everywhere. So once again, thank you. We have time maybe for one or two more people. Maria has been the one engaging with all of these new and old partners. Who shall we hear from? Perhaps our last speaker today.
Thank you, Rita, and forgive me for my pronunciation, but let's listen to Mohairwe Ronald Sion, who's already unmuted. Go ahead, and please don't forget to introduce yourself.
Yes, good morning from Uganda. I'm called Ronald Mohairwe Zion, the Director of Association for Promotion of Sustainable Education Services in Uganda. This is my first time to happen or to be in Teach to Reach 10. I'm so happy. Our members are so happy. Currently, 3 members of my organization are already in the session. There are 3 of them who are already attending right now. The biggest challenge that we have faced in the community is about the information dissemination. Like, for example, yesterday we got some challenge whereby there is a breakout of polio in a district in eastern Uganda called Mbale. So my organization helped in through teaching the girls, disseminating the information to the community, more especially in the lower and hard to reach areas.
Understood. Thank you, Mohairwe Ronald Zion. And I take note of a very strong presence of Ugandan health professionals and partners in today's in this Teach to Reach, as well as in the responses to the Teach to Reach questions. We thank and honor health professionals who share with their colleagues and the organizations again who share with their networks. As you can see, this number is quite eloquent, and we attribute it to you as organizations that have joined the Teach to Reach family as partners. We're really in Teach to Reach 9. This was in October 2023. Some people think it's an annual event, but it's actually several times a year. And last time, 17,662 health professionals. And this time you heard this number, but it's worth showing again. You are 21,000 398 strong, including more than 12,000 Anglophones registered for Teach to Reach today. Of course, we know that many of you won't make it due to connectivity and other issues, but there are many ways to catch up and many ways to keep going. So we're 3 minutes away. I see many in our Zoom studio, many hands raised. We're going to go into the opening ceremony. Perhaps, Maria, we'll have time to hear from one more partner, one more organization. Do share your messages. I'm just going to go and look at the stage, which is where most Teach to Reach participants are. We have just to recognize and acknowledge some of the messages from Evans Juta, Henry Back, Patience Adeda, Thulisile Mazia. From Eswatini, Dr. Abubakar Jafar Usman, who's hoping for fruitful deliberations. Umar Garba, Chipo Sitambile, Guaya, who says, hello, everyone. Chipo, don't just say hello. You can tell us more. Tell us who you are, why you're here, what you're expecting from Teach to Reach. Patience is sorry that she hasn't been a part due to many official assignments. She's right now in transit, but you're still managing to connect. That's wonderful. Patience Anumu, Tito Gomez, Wande Maneg de Sawadogo, and Husseini Garba, Rina Day. I'll stop here. Back to you, Maria, for maybe one last. We have just 2 minutes before going into the opening ceremony.
Thank you, Rita. Justine Namuli, you're already unmuted. Go ahead. You have a minute or two to introduce yourself and your organization. Justine.
Hello, everyone. My name is Namuli Justin. I am from Uganda. I am the CEO of Jasen Health Ventures. I am a public health specialist. I am a regional coordinator for the Uganda Youth Coalition for SDGs, which is an umbrella organization for all youth-led organizations in Uganda. And I'm also a social entrepreneur within the health perspective. I became a Teach to Reach partner because of the main reason was this is a quite unique platform that I've not seen before, that recognizes small organization, recognizes the work of people, even community health workers, which is so rare to find. We usually have seminars that are on global level. We do not really get to understand what people are doing in the community. And I could credit you for that. Thank you.
Thank you very much indeed, Justine Namuli. And that will be our last leader that we'll hear in today's Leaders and Partners Forum. I do want to say we have much more ambitious plans. We were overwhelmed, and I think Maria in particular, because she was trying to keep up with all of you. It's been absolutely amazing seeing the level of response and interest, and we have much bigger plans for Teach to Reach 11. Check your inboxes if you're a local partner, if you're a leader in a local organization, wherever you may are from any country. We'll be inviting you, and next time we'll be doing a lot more now that we have gotten to know you and you've gotten to know us and understand what this Teach to Reach family, and we hope that you'll get a lot out of today's sessions for yourself, for your organization, and for the communities that you serve. Once again, thank you. We're now going into the opening ceremony with two items at the top of the masthead, if I may say. The first one, you're going to hear from the Women Who Deliver Vaccines Collective, and we're also going to announce the new initiative from the Nigeria Movement for Immunization Agenda 2030, supported by the Geneva Learning Foundation, part of Teach to Reach. We're doing a launch today. We'll be doing a more official launch later, and this is in partnership with UNICEF and the National Public Health and Community Development Agency of Nigeria. So, without further ado, I'm going to turn to Charlotte. It has now become a tradition at Teach to Reach that it is the Women Who Deliver Vaccines Collective who open Teach to Reach, and this is the opening ceremony. So, Charlotte, over to you. What are the Women Who Deliver Vaccines going to share with us today, and who is going to speak on their behalf?
Thank you very much, Reda, and it's always a great honor to have women who deliver vaccines to take the floor at Teach to Reach. Just to say that Women Who Deliver Vaccines is a collective of 143 women from 38 countries who came together in February 2022 to share experiences, to learn from one another, to support one another in the work that they are doing to address the challenges they were facing as far as immunization is concerned. And to start today, I would like to invite Margaret. Margaret, I'm asking you to unmute. Margaret Nabagala Tambazi from Uganda. Today we want to talk about the impact of climate change on immunization. And if you're able to unmute yourself, I am inviting you right now to do so. To unmute, tell us who you are, what you work, where you work, and what you do. If Margaret, okay, I see already unmuted. Margaret, over to you. We are listening.
Hello.
To you.
Hello. Can you listen to me? Do you hear me speak?
Yes, I can hear you. Yes.
Thank you very much. I greet everybody here. I salute everybody and I thank everybody, especially the organizers, for organizing this very great, enormous global interaction with all health professionals from across the globe. I'm called Dr. Margaret Nabagala Tambazi Kasita. I'm a public health specialist, and for quite some time I've been working with UNICEF as a UNICEF consultant in charge of Masaka region in Uganda. I'm also a Rotarian who has served as a past president in 2 clubs, that's Masaka Rotary Club and Luka Health Club. As a global organization also, Rotary also helps in participating, especially in seeing that polio comes to an end. So I've really served, when I was serving in UNICEF, I've really seen that we try as much as possible to solve public health issues, and I've joined Teach to Reach because this global organization really gives us a chance to share, to join other health professionals from across the globe, to share their work stories, their views, their experiences and challenges within their working environment. And this helps us also to see how they have managed those challenges and also to get solutions to some of them. So this really is very good. I joined the Teach to Reach for quite some time now, and I was invited as a guest of honor 3 times, although I missed the first 2. This time around, I think I'll be able to talk about it, and I really recommend and thank very much those who have organized this learning session, because we learn from different health professionals from different countries, how they have really managed their challenges and how they're getting about. I shared my I don't know whether this is the time to share, but when they told us about the climate change, the climate change has affected globally. I mean, in my communities, because it rained heavily this past month, and so many people ended with no homes. The rains were too much. They destroyed so many houses, and also some plantations, food plantations. People went without food, and the end result is, of course, kwashiorkor and other malnutrition challenges. And also, with a lot of rain, shambas and shrubs and then bushes overgrow, we end up with malaria, because even in the pools, malaria becomes rampant, and so many deaths, so many lives have been claimed because of a lot of malaria. Malaria is number 1 in Uganda as the number 1 cause of death. Thank you very much. I think I can get over to you, but there's a lot to share, but because of time limitations, I think I'll stop here. Thank you very much. Teach to Reach, please continue. Thank you. Over to you.
Thank you very much indeed, Margaret Nabagala. And for those of you who'd like to read more and learn more from women who work for health, for the International Women's Day, 177 women from Teach to Reach, from the Movement for Immunization Agenda 2030, from the new climate and health community, shared their experiences And this has formed a collection of stories that you can get. You simply have to request it on the Geneva Learning Foundation's website. It's www.learning.foundation/women. You put in your name, your email, and you'll receive both the collection as well as a series of stories from women that you'll receive by email that can be shared with friends and so on. But Charlotte, before we hear the next speaker, we do have something very special for the immunization community at Teach to Reach, and that is directly related to the work done by the Women Who Deliver Vaccines collective over the last few Teach to Reach sessions. And this is why, let me see if I can find sufficiently dramatic music to introduce. This is a real first. We're going to ask you what you've learned from Teach to Reach, but we're also going to demonstrate it in a way that we never have done before. So this is two collections. One is of experiences and the other is of tips from the frontline. And over the last few Teach to Reach sessions, we've had literally thousands of women and men who work on HPV vaccination, on cervical cancer prevention, and other areas of health who have shared their experiences. Our Insights unit, Charlotte amongst them, she's going to tell you a little bit about what's in this handbook and in the tips from the frontline, have reviewed all of them, analyzed everything that you shared, all of the experiences, and there were literally thousands of them, to come up with what are the best top tips if you're involved in HPV vaccination. Charlotte is also going to remind us why cervical cancer is such a critical health issue. Charlotte, over to you. What is this HPV vaccination experiences and collection? Why is it important? How can health workers use it to make a difference?
Thank you very much, Reda. So like you said, over the past Teach to Reaches, we have been reaching out to health workers and asking them what they are doing to reach girls with the HPV vaccine and how they are addressing the challenges that they are facing. And we learned a lot from those experiences. We listened to experiences from national level Ministry of Health staff to the front line. We got country-based experiences from Burkina Faso, from Sierra Leone, amongst other countries, and we decided to take all of this. We got specific experiences from countries like from health workers, community health workers in Kenya, on what they were doing to increase HPV vaccine uptake, and we put all of those in that experience sharing package. And then amongst all of that which they were shared, they were very useful tips, very useful guidance that was made available. How to engage community leaders, how to engage teachers, what strategies work best for HPV vaccination. So we took all of these and we put them in a second document that we are making available for you today. Why? Because the HPV vaccine is the best known way to prevent cervical cancer that affect yearly hundreds of thousands of women from across the world, and most especially in sub-Saharan Africa and in the undeserved community. So we think that if you are working in immunization, you should. This is a wonderful opportunity to get this handbook and the handbook of experiences that could be very useful. And it is from what you shared of what you are learning at Teach to Reach that we thought this could be a very useful tool. Thank you, Reda.
Thank you very much indeed, Charlotte. So look forward to this HPV vaccination. Two collections, one is of the experiences, the other is really tips from the frontline. Now we're going to turn to, I believe, Charlotte, you have a second speaker from the Women Who Deliver Vaccines collective. We'd love to hear what she has to say as we are celebrating later today what we call Humanly Possible. It's the 50 years of the expanded program for immunization. Who shall we hear from next, dear Charlotte?
Thank you, Reda. So we have Gifty Akosua that's already unmuted. She's one of the founding members of the Women Who Deliver Vaccine collective. And Gifty, would like to hear from you, especially the work that you are doing in immunization and also how climate change is impacting your work. Gifty, over. And please do start by introducing yourself.
All right. Hello, everyone. Thank you. Thank you, Geneva Learning Foundation, for this opportunity. I'm Gifty Akosua Jigbe, public health nurse, and I also work in the disability field from Ghana in the Central Region, Gomwa West District. And I'm happy to be here with Teach to Reach once again. Yeah. So let me just go straight to the question. You were asking how. Please, can you help me with the question again?
So we say you talk about your work in immunization and how climate change has impacted that.
All right, thank you once again. So in Gomoa West District, I would say we work as a team. We do our best. I mean, in Ghana Health Service, you know that when we say universal health coverage, even in the hard to reach areas, you're supposed to go there to help children 0 to 5 years with immunization. But one thing that we were lacking was how we're able to how to bridge language barrier for persons with disability. And that was where I volunteered to actually come in to make sure that if we are advocating for universal health coverage, then we have to also make sure that no one should be left behind because of language barrier. And so voluntarily I started with my interpretation using the sign language because of seeing my own biological sister who became a deaf just because she missed measles vaccination. So I realized that women have a bigger part to play when it comes to immunization, because my mother, looking up to her after that experience, I realized she wasn't happy. And so she has become an advocate, making sure that all her grandchildren never missed immunization. And looking at that, I also took it up, and then using that or learning from my sister with the sign language, I have to also now implement it in my area where I'm working. And I would say this has really brought a lot of improvement, where I'm talking about where we see this group or this marginalized group with their families not even willing to bring out their children for vaccination because some have certain experiences with they giving a vaccine and then something happened to their child, or maybe somebody once shared something, and trying to clear all these misconceptions and trying to allay all the fears from them and trying to prevent this vaccine hesitancy. I would say that Geneva Learning Foundation has really helped me to be able to help educate this community when it comes to vaccine hesitancy. And I've seen improvement, especially when it came to COVID-19, seeing how they were able to give out, they themselves willingly trying to take this vaccine. And also climate change, yes, I would say has really disturbed us, or let me say in a way, so positively and negatively. So positively, I would say that one, we need the rainfall, yes, because we need to grow our vegetables. But here lies the case. Now they are crying, asking that when are we coming for immunization, because we don't even have good roads already. It's a hard to reach area, and now how do we even use our motorbike, because if we try, you're going to fall. So I would say climate change has really caused a lot of harm, leaving some people there, and you have to just struggle before you reach them. Yes.
All right, thank you.
Thank you so much.
And over to you.
Indeed. Now, we've heard about immunization, and as I said, at heart, we started with immunization just when the world's immunization staff were being asked to introduce COVID-19 vaccination wherever they were. Last July, we launched a call to action to initially the Immunization Network and said, are you concerned about climate change and health? 4,700 of you responded within less than 10 days. And so we asked this question: is climate change a threat to the health of those you serve, and why? And you told us, most of you who responded, this is from a sample of 1,234, said that you were part of the family or a trusted friend. And now we asked you, is climate change a threat to the health of a community that I serve? Most of you assigned it the highest threat level and painted a very scary picture. We also asked you, do you worry about climate change? And this is why for this 10th edition of Teach to Reach, at the top of the hour, we'll be kicking off our very first plenary session at Teach to Reach, entirely focused on the sharing your experiences, your observations of how climate change is affecting your community and climate change is affecting the health of your communities. Now, in this opening ceremony, what we want to do is ask you the first set of Teach to Reach questions. As you know, before Teach to Reach, we ask you to answer questions, to share your experience. You can have a look, and we shared with you the shared experiences from Teach to Reach 8, 9, Teach to Reach 7. You can go back in time, and each time we ask a different set of questions. And these shared experiences provide deep insights that are also shared back as a synthetic report. For people who have no time, you can get the 2-page version, or you can delve into the literally thousands of experiences that are shared at Teach to Reach. What happens today is really an occasion to meet, network, and learn together through this conference and networking platform. If you're in our Zoom studio as a guest of honor, you're warmly welcome, but don't miss out the best part of Teach to Reach, and that is really to participate in the networking. And these one-to-one networking sessions are unique. You press on a button and you're connected to another health professional and can have a private conversation. So that is what happens at Teach to Reach. The next question is, of course, what happens after Teach to Reach? And this is where we're going to turn to you, because remember, the first questions we ask those of you who are not here at Teach to Reach for the very first time is, how have you used something that you learned at Teach to Reach to improve your work? That is ultimately what it's about, as well as developing your professional network. So 2 years ago, the Geneva Learning Foundation, working with a movement for Immunization Agenda 2030 leaders, established the Knowledge to Action Hub. And really, Teach to Reach is part of this Knowledge and Action Hub. And everything you share will, one, be given back to you as a community. That is our first commitment to you. And second, we'll be asking you, what are you doing with what you learn? How is it helping you to make a difference? That is ultimately what we are interested in, and that is the process that we're starting today. What happens to what you share is that it is giving back to the community. Those who wish to be named will be named and honored as Teach to Reach contributors, and that is the Teach to Reach process. Now back to you, Charlotte. We'd love to hear. We have some questions, of course, for folks in the room as part of this opening ceremony. If there are if there are other people who'd like to speak on behalf of the Women Who Deliver Vaccines Collective, we'd love to hear them. Otherwise, we'll dive into this first question. Which Teach to Reach questions did you answer? What did you share? Over to you, Charlotte.
Yes, Freda. Thanks. I'm inviting Anifat Egujobi. Okay, you are unmuted. Over to you. And please do start by introducing yourself.
Good morning, everyone. Good morning, good day, depending on where you are hearing from me. I'm Egujobi Anifa Tomawumi. I'm working with Lautech Teaching Hospital, Ogbomoso, Oyo State, Nigeria.
Yes, Anifa, we hear you loud and clear.
Yes. In fact, I like to be part of the Teach to Reach community, because it's always teach me then how to relate with people, how the immunization is going on. So I always have updates in Teach to Reach. Then about the people that I've invited. Yes, I've invited some people in my office. Then likewise in Oyo State platform, I invited people, and some of them have joined to Reach.
Wonderful, Anifat. Yeah. And can you tell me, Anifat, ahead of Teach to Reach, you received by email, of course, many different questions. We did not expect you to answer them all. Can you tell us which Teach to Reach question you did answer? What did you share from your experience?
Yes, I answered. I cannot recollect the one that I've answered, but I've answered many of it. Then I've answered many of them. Like climate change, I've answered. Then I answered neglected tropical diseases, then malaria. So any one of them have answered before.
And what, for example, on the subject of malaria, what did you share?
On malaria, I used to tell my people in my community about the causes of malaria, what causes malaria, then if any of their children or pregnant women have malaria, what to do to them. Like they should not just neglect those people that have malaria. They should make sure that they take them to the nearest hospital. Hospital or community health in their environment. So
All right, thank you, Anifat. And what is, for example, on the subject of malaria, what would you like to learn from your colleagues, from their experience, if they're confronted, for example, to this question of caring for pregnant women who are affected by malaria?
Well, for what I would like learn more is that another way of treating malaria, like in my place, I told them I've already informed them about uses of bed net to be using. Then I've also informed them about when they have malaria, they should take some drugs or they should go to their nearest health center. Then do and don'ts, they shouldn't allow the mosquito bite at all to bite them. So I've already told them about that. So if there is any other thing that they can learn more on the malaria issue, they should also, I am expecting my colleagues to teach me so that I can always impart some knowledge into my community to tell them what to do and what not to do in order not to combat malaria.
Thank you, Anifat Egunjobi. I think we owe you a round of applause for this contribution. Thank you for making time to be here today. This is right now the opening ceremony, and we are now going to spend the next 38 minutes hearing from you about your experiences around these kinds of questions. We are also interested in what you expect from Teach to Reach 10. What challenge do you need help with? And for those of you who participated before, name one specific idea that you learned at Teach to Reach, and how has this idea helped you? So these are the kinds of questions. If you would like to answer them, if you're with us in our Zoom studio, you can of course raise your hand, and I see many hands raised. And if you are on the stage in the conference platform, in that case I encourage you to type into the either in the Q&A or into the chat. This opening ceremony is really about getting to know each other and really looking at all of the range of issues that we're going to be exploring through the sharing of experience, through the power of peer learning at Teach to Reach 10, this 10th edition of Teach to Reach in English. Tomorrow will be the sessions for the Francophones. Before I turn to Charlotte and Maria for our next speaker, I want to, this one caught my eye. Susan Adina says, "Oh my heart has been fully captured by this forum. I'm now ready to change my current career if I can be trained to do professional community work. I'm not a health professional, but I'm currently doing some community work under my small CBO known as HEAL." And she says, "Reda, kindly help me to do community work. I want to be with the people, not in the office anymore." So Susan, perhaps there are some organizational leaders who are participating as Teach to Reach partners that you can who can reach out to you. And Farm Bernard Badu Bediako would like to share on malaria. Now, let me just remind you, there is a dedicated session on malaria. But what we want to know in general is, at this stage in the opening ceremony, which Teach to Reach questions you've answered, what did you share, why, and so on. So I don't know whether to turn to Charlotte and Maria. We've never had the options like this before.
So Reda, we have some mics that are already open, but I think we'll go first for those that have not spoken since we started this morning. So Nduka also, we'll start with you, and then we'll also apply our rules of fairness. So if a man speaks from one country, the next person should be a woman from another country. So we'll start with you, Nduka, also.
Good morning, everybody. Good afternoon. Good evening, wherever you're watching from. My name is Mr. Nduka Ozo. I've been up since 7 a.m. I've had a network meeting this morning. It has been wonderful, and we've exchanged contacts, which we hope to continue after this conference. I answered so many of the questions, but the one I want to talk about here is a non-tropical disease, which I shared a very heart-rendering story of how a community in Kukereta in Damaturu, that is Yobe State, during one of our outreach programs. Everybody who is familiar with the Northeast Nigeria knows that it was devastated by Boko Haram insurgency, and a lot of people went into the bush to live. And while they were in the bush, they mixed up with animal diseases and all that. I shared a story of a 6-year-old boy who turns out to be the head of the family. And this boy and the rest of his siblings were all infected by viral hepatitis B. And then, unfortunately, there wasn't any program on ground in the States as at that time to support these kids. On my own, I tried what I could do to help them. But for the fact that I'm not from that state, I am from the southeastern part of Nigeria, but I moved to work in Yoruba State because of the passion I have for the people affected by the insurgency. So I tried on my own to see how I can help these children. And I stayed there for 2 weeks and then rendered the little help I could render, and then went back to my community. After some months, I came back, and the first place I went was Kukereta, IDP camp, to ask for those children. Unfortunately, they were all dead because of the hepatitis infection. There's no treatment, no vaccination, no kind of support. Even at this point, at the national level, we only have built on the documents, but there is no serious intervention program on viral hepatitis. And that was the story then. I asked another question. How do we go about this? How do we help these people who are affected by these non-tropical diseases? There is a global fund for HIV. There is a global fund for malaria. There is a global fund for tuberculosis. Even the last COVID, we saw the whole world stand still because of the COVID. But that was understandable because of its devastating effect. But here in this world, especially in developing countries like Sub-Saharan Africa, we don't have such funds to combat non-tropical diseases. Why is that lacuna there? I think the world has to do something about it because it is affecting the most vulnerable communities around Africa. And what I shared about Kukereta in Damaturu is not just a fiction. This is a story of what happens, and it's happening in other parts of the Northeast. And that is where I carry out most of my activities. If you go to the villages and communities, you will weep for these communities. And I think the world should focus and do something about it. Thank you.
Nduka Ozor, thank you. We hope to hear from you again in the NTD session. We thank you also for having shared this story in the lightning chat. What do you expect to gain from meeting colleagues, sharing this story with them, listening to the stories and the experiences that they have around difficult challenges, such as the one you just described?
Reda, from the little conversation I had with some of the colleagues in the network meeting, I think it's something that we can take further from there. I want to learn how they are carrying out their own intervention, advocacy programs, program designing, crowdsourcing strategies for community intervention programs. We've spoken a lot, and I think there is so much I can gain from there. I am so excited. I can't wait for this conference to be over so that I can start making those networks and we start discussing, and it will impact in what we are doing here in Nigeria effectively. I'm too sure of that. Thank you.
And Nduka Ozor, you are obviously a very talented, smart organizational leader. You have many options. You could go to the websites and find guidelines, guidance documents, resources, tools from all kinds of organizations in your country at the global level as well. You could connect to webinars where technical experts make presentations and explain the best available global knowledge on some of these issues. What for you is different about Teach to Reach, and why is it worth your time? Because I'm sure you have many other things you could be doing this morning since 7 o'clock in the morning.
Yes, the fact that we are listening and we're getting information from the community-based organizations, community health workers, people who are dealing directly with the affected. This is where it is important. I'm not just talking about people who stay in the office, develop programs and develop activities and then take it off. But these are people who are dealing directly with the hard to reach people, with the community people. This is the most important thing for me. I am not talking about theory. We're not talking about theories. We're talking about practical experiences that we can apply in the work we do. Thank you.
Indeed, thank you very much indeed. Now, the heart and soul of Teach to Reach. You're going to see it here. I believe Charlotte and Maria, the time has come. We're at the halfway mark in this opening ceremony. As you know, we asked you many questions, and I'm pleased to say you're seeing the beginning of a list that is 44 pages long of more Teach to Reach participants who have taken time to respond to one or more Teach to Reach questions in which they're sharing their experience on a specific topic. So I suggest we go right into it, and we really do justice to the commitments. This will take a few minutes, but the names are in alphabetical order by first name. If you shared, then please consider yourselves honored and recognized today at Teach to Reach 10 for sharing your experience when nothing, you had no obligation to do so, and you did so because you wanted to. Page 444. Teach to Reach is about what you know because you are there every day. And sharing that knowledge, not just with the colleagues around you, but with colleagues from all across the world, is called peer learning and can make a difference. For those of you who are just joining now, these are the names of all of the Teach to Reach contributors, together with the information they provided. Each person here shared an experience, responded to one or more Teach to Reach questions. This is the core knowledge that goes into Teach to Reach. You'll hear today a few voices during the live sessions, but these Teach to Reach experiences combined bring together thousands of experiences, what you know because you are there every day, what you are doing about it, across a range of topics, including but not limited to climate change and health, neglected tropical diseases, malaria, and of course immunization, which is where Teach to Reach started. Maria Monzon has contributed, has answered many Teach to Reach questions before joining our team. Maria, what are your thoughts when you see how can you tell us about your experience in the past listening to receiving so many questions, figuring out which ones you had experience to share on? Why did you do it, and how did it help you?
Thank you, Rita. Well, I think the main reason why I did answer it, one of my tricks was to answer them right away, because as all of us, we're very busy. And when you postpone, I guess you never find the right time. So anytime I would see one of the TGLF's emails, I would find like 5 minutes to answer them right away. And I did so because I knew it mattered, because I knew that I would get the experiences from other people, and that was enriching. So it's never to leave that opportunity pass.
What you're seeing in front of your eyes is the names of all of the Teach to Reach contributors. As you know, over 21,000 health professionals are registered. But of those, we especially honor and commend the more than 1,500 who have shared a specific experience in response to one or more questions. I believe the record is Tafarola Mutonga. I hope we can stop on her name, and I was hoping she would be in the room, but she's not, who answered 40 Teach to Reach questions during Teach to Reach 10. But it's not about the numbers, it's about the quality of the experiences that you share and how each experience can help your colleagues. Charlotte, what are your thoughts? As you see, we have 44 pages of names scrolling before us, and these are the names of people, actual health professionals who took their time out to share their experience, and this is the backbone, the roots, the foundations of Teach to Reach. What are your thoughts? You've seen Teach to Reach built by thousands of participants, by our small team as well. What are your thoughts as you see this list? What does it mean to you?
Yeah, rather I am overwhelmed and honored by the generosity of frontline health workers, those that choose to share what they are doing to make a difference in their communities, and also sharing very personal stories, in some cases of what they are learning, what the challenges they are facing, maybe their failures, and also the hope that they have when it comes to primary health care and primary health care intervention. So I can just join you and the rest of the Teach to Reach team to honor these contributors. Thank you, Reda.
If you see a name more than once, it is because Nicholas Kashama, for example, contributed more than once and contributed many times.
Yes, Reda. And that was one person we have to honor, as well as Tafarode from Kenya, who took the time to respond to almost all of the Teach to Reach questions.
That's right. And just to say, if you did not answer a Teach to Reach question this time, you are still warmly welcome to the Teach to Reach family, and we look forward to the opportunity to answer a Teach to Reach question next time. But these are the health professionals who are contributing to the knowledge generated by Teach to Reach. Today is an opportunity to learn with them and also to share your own experience as well. List of names are those of you health professionals, thousands of health professionals who've taken the time and care to share their experience for the benefit of their colleagues. This is the heart and soul of Teach to Reach before Teach to Reach, and you'll get to network today, meet, network, and learn with them today in the networking sessions as well as the plenaries. Right, you can see we're almost there. We had the names that begin with Y. And here.
I also just wanted to add that these stories are stories of resilience, experiences of resilience from health workers who have no intention of giving up no matter the challenges, because they have the health of their communities at heart.
Wonderful. Thank you very much indeed, Charlotte. And now we're at the 40-minute mark for this opening ceremony. We wanted to take this time. And yes, it takes a few minutes, but we really feel it's important to recognize and acknowledge and then to give back to you the contributions that you've made and to honor the contributors, the health professionals who've taken time to share. Teach to Reach participation has been ascendant. You can see actually in March 2021 there were 2,604 participants. June 23, 16,835 participants. A little bit about who attends So there's a growing global community. Most of you work in health facilities and districts, around 80%. Half work for government, half for civil society organizations, half for francophones. And then you can see some of the other statistics here. But 1 in 5 of you face work in places where there are armed conflict. And again, it's always about the connections that you make with each other. It's not about the relationship you have with me, Charlotte, or Maria at the Geneva Learning Foundation. This is social networking analysis mapping the connections that you made with each other. There are 2 clusters because of francophones and anglophones. But this is peer learning in action. And now back to you, Charlotte. This has been a long but worthwhile sequence. I'd love to hear more voices, before we make the announcement for the Nigeria Movement for Immunization Agenda 2030.
Yes, Reda, I am inviting Gloria E. Banu, whose mic is already unmuted. Gloria, please go ahead, introduce yourself and answer the questions. Gloria? Are you able to hear me?
Yes, I am able to hear you. Just that I have to change to my to my phone because my laptop will soon go off. So my name is.
While you do that, okay, please go ahead.
Yes, my name is Mbanu Gloria E. I am a lecturer with the University of Agriculture and Environmental Sciences, Omago. I'm the Executive Director of the Initiative for Infectious Disease Control.
Gloria, could I ask you to turn the volume down on your other device because we can hear it's feeding back into the your microphone.
Okay, in that case, let me put off my laptop because it will soon go off, and then use my phone now. Thank you.
Okay, so while you do that, maybe we can listen to someone else. Lilian Mutua.
Yes, go ahead, Lilian.
Morning.
Welcome to you.
From Nairobi, Kenya.
Yes,
am I audible?
Yes, loud and clear. You told us you've been able to learn how to negotiate with deserving, hard-to-reach communities and learned communication strategies from Teach to Reach. You've seen the power of decision-making lie with the people. So tell us what you mean by that. And first, do introduce yourself.
My name is Lilian Mutua. I'm the head of health promotion. I work in Nairobi City County, the health sector in Nairobi, Kenya, which is the capital city of Kenya. Why I'm saying this is that through the interactions that I've had in Teach to Reach, and even when I look at the questions that people are answering, the interactions, I found that globally, each country has its unique barriers or challenges that they are facing during the delivery of immunization. And more so, I've learned, especially in Africa, we find the same challenges. We have the hard to reach communities, we have the 0 doses. But when I look at Nairobi, being a capital city, 60% of my population lives in the informal settlement because they have migrated to Nairobi to look for livelihoods. The uniqueness is that when you're trying to reach these communities, you'll find the parents, the caregivers, or the guardians wake up very early to go to work. Their priority is to get something for food on their table, to get something for their shelter, to educate their children, and more so immunization comes as another a secondary issue. So most of them are young parents, young people, and we have learned, what I've learned through my experience of listening to the sessions that we've had, is that I now focus to deliver information about immunization, not when the parent has a child, but even way before, starting with children in school so that they can be the agents of change in their communities, at their households. They're also able to feedback whether their children who are born within their household are getting information, and that way we are able now to connect with the community health promoters to go and trace whether there's a child who has been missed. We also are now negotiating with the religious leaders, the administrative leaders,
the influencers in different communities, and the decision makers who are the gatekeepers. So it has been brilliant that I've also learned what Nigeria is doing, what Pakistan is doing in the HPV vaccine delivery. And I'm looking at Kenya, where we are at around 33% of the target population at first dose and less than 20% for the second dose. So the learnings that I've taken, I'm listening to different strategies and different ways that different countries are empowering the communities to make decisions to take up different types of vaccine. Nairobi is also very unique because the affluent community, which is 40%, normally they go to the high-end hospitals, but we are not able to negotiate with them. So through them, to reach them, we use the churches where they go, the religious institutions, the various religious institutions, their social leagues, different communities like the Rotarian, the Hindu Council, and other religious institutions, so that we are able to reach this information with them. We are also using the media, we've engaged different medias and also strengthened our partnership with them just to promote the issue of routine immunization and the life post vaccines. I know as Nairobi County, we take lead in Kenya in delivering of the COVID vaccination. We are now at 69%, while the national coverage is below 50. So I really appreciate the learnings I'm getting here, and especially being a health promotion officer, the different strategies that people are using on the ground for demand creation. Thank you, and over to you.
Thank you very much indeed. We are in this opening ceremony exploring what challenges you need help with. How can Teach to Reach help you? This can help also some of the participants who are listening to say, hey, I have an experience with this. Maybe I can try to connect with the speaker. That is also very much what we are hoping for, what we are hoping will happen at Teach to Reach. Now we have 13 minutes left. I believe Charlotte has our next speaker ready to go. Charlotte, we do need to do the first announcement of the Nigeria Immunization Agenda 2030 Collaborative. There will be a second announcement later. Go ahead, Charlotte.
Definitely, Reda. So the mic that is open, Suzanne Adina. Suzanne, you have the floor, and please do start by introducing yourself.
Hello. Thank you. My name is Susan Adina from Kenya. Can you hear me?
Yes, loud and clear, Susan.
Yes.
Tell us what you do and what challenge do you need help with today at Teach to Reach? How do you think peer learning, sharing of experiences from colleagues from all over the world who are here today can help you with this challenge?
Okay, so first I'm a psychological counselor in a university in Kenya. So in my day-to-day work, I interact with a lot of issues, and then I do community work through my small CBU, as I indicated, known as CBU. That's just personal work that I do with a few women in the village to try and handle a few things that come in. So my main challenge that has made me to get interested in Teach to Reach is the neglected tropical diseases, largely. Malaria is a problem here. Then we have the area where I come from, we have jiggers. I don't know whether you've heard about jiggers. Jiggers is quite a problem here as well because of the heat in this area. So mainly I would just be interested to know, we have nets. The government gives us mosquito nets for the net beds, but we still have very high levels of malaria in this area. This is because the mosquitoes are not biting people when they are sleeping, but they are biting people when they are still seated within the house, not when they are in the beds. So I'll be interested to hear from the professionals, how can we be able to eliminate the mosquitoes that are around when people are still seated in the evening before they sleep? And then I would also be interested to inquire, can the malaria vaccine be administered to adults? Because in Kenya today, the malaria vaccine has been introduced for children. I don't know whether it can also be introduced to adults. Like in my house, almost every week we are getting attacks of malaria. And so that means within every 2 weeks, we have to take malaria treatment. And I'm getting worried that at that rate of always being on malaria treatment, it may be risky. We have nets, new nets, brand nets, which we've bought, others have been given by the government, but we are still struggling with malaria. And my last challenge is largely about the climate itself. We have challenges of fluctuations in the climate, so people are not getting food. They plant food, rain disappears, food goes. They plant food, too much rain, the food disappears. So this then impacts on the nutrition of the children and the entire families that are here, because the feeding becomes quite a problem. I'm in a very poor rural village in Kenya, and that's why I have a special interest here to see what I can do. I hope I've answered the question.
Thank you very much indeed, Susan. Adina. All right. Wonderful to hear the challenges. So we're not going to try to answer any of these questions now, but we want to feel the pulse of Teach to Reach. What's on your mind? What are the challenges on your mind? We only have 8 minutes left. And dear Charlotte, we do have the first announcement. We'll be making a second one during the EPI at 50 session. And I believe we are now going to share this exciting announcement specifically of interest to Nigeria scholars and Teach to Reach participants. Charlotte, are you ready?
Yes, Rada, I am.
All right, so and of course, first of all, we're very proud of the amazing community of Nigerian scholars, the largest in the world in the Geneva Learning Foundations network, followed closely by the Democratic Republic of Congo. Countries from all over the world, 137 countries are represented, but we're very pleased to introduce this today, and we look forward to, perhaps we're going to lower all the hands and ask our Nigerian colleagues who are with us in the Zoom studio, or if you're on the stage in the conference platform, to get ready to share your questions and comments and to react, because this is for you. So here we go. Charlotte, can you tell us what we're looking at here?
So it is the very first immunization collaborative for families and communities in Nigeria, and it's an initiative that is championed under the banner of the Movement for Immunization Agenda 2030, supported by the Geneva Learning Foundation, UNICEF, and the Nigeria Primary Healthcare Development Agency.
Indeed, and you can go right now. Applications are not yet open, but if you are from Nigeria, or actually if you're not, we're going to explain that. You can go to the learning.foundations/Nigeria page, and you'll see additional information about the Immunization Collaborative for the children and families of Nigeria. The goal is really to share experience, but this time where Teach to Reach stops at the sharing of experience, and then we ask you in the follow-up, what have you done with what you shared, what you learned? Here we'll be really focusing on taking action with fellow professionals to strengthen routine immunization, and we're very proud to be doing this in partnership with UNICEF support, and of course in partnership of the National Primary Healthcare Development Agency of Nigeria. If you are a health worker in Nigeria and you want to make sure every family is protected from diseases that can be prevented by vaccines, this is for you. It does not matter who you are, what your job is, or where you work. What matters is that you want to make a difference for the families of Nigeria. So now over to you. We're going to go back to the... we're going to get some reactions from Nigerian participants. If you are from Nigeria, whether or not you have been participating in the planning and design meetings for this immunization collaborative, we'd love to hear your voices. We lowered all the microphones, but we know there are many Nigerians in the room. Let's go look on stage to see if there are any reactions. So we have Dr. Kaiser Parviz from Saudi Arabia, Adamu Haruna from Sokoto, Nigeria. Haruna, what do you think of this initiative? And Catalina from the Republic of Moldova. So, all right. So we're waiting for our Nigerian leaders of Immunization Agenda 2030 to raise their hand if they're in the Zoom studio to share their comments. All right.
We have to raise hand.
I see. Yes. Who shall we hear from first, Charlotte? We have just a few minutes left. We'll be making a more complete announcement in the afternoon session, humanly possible. Vaccines work really focused on this 50 years of EPI.
So rather we have Fanny Ogu, whose mic is already open. So Fanny, we'll start with you.
All right, go ahead, Fanny.
Hello, everyone. Hello, everyone. I'm done with code. I've just sent a message to you, Charlotte. My voice is not audible at all. Thank you so much. I'm Ambassador Fanny Ogu, a public health specialist, immunization professional. I'm done with code. I'm so sorry. My voice is down. My voice is not audible. I've just sent a message to.
So sorry to hear that, Fanny, and we wish you the quickest recovery. And so we'll go straight away to Ndayo Iwat and then Mohammed Otaru Reda to conclude.
Thank you, Charlotte. Thank you, the Plenary Foundation. We are the president. I want to introduce myself as Dr. Iwat Ndayo.
Dr. Ndayo, can you please unmute yourself again?
Okay, I'm unmuted now. I hope I'm fine.
Yes.
Am I audible now? Okay, thank you, Charlotte. And I'm still appreciating the foundation for this important occasion, and congratulate ourselves too for being there as always. Remember, as pioneer scholars from Nigeria for the Plenary Foundation and right now ambassadors, I want to say that we have been complaining about the involvement of the leadership of immunization programming in the country, and this is a groundbreaking initiative, and I'm sure MPSCDA leadership and the Federal Ministry of Health and Social Welfare in Nigeria will be absolutely connected with this focus that is so strategic and global, so that we can act locally to ensure that no child is left behind. And the life course immunization programming is also in view, and I want to say my actions in the immunization programming took a boost when I joined the Geneva Plenary Foundation from inception in this country. And I want to quickly put what happened when we rolled out the first launch of HPV vaccination in the country. And I was participating with support from Gavi and in the social mobilization and advocacy, communication and social mobilization aspect. And I dealt with one district in the Federal Capital Territory of Nigeria. It was a huge success, and my reports are all there for people to see. What did I do? Community dialogue and community engagement insights from the ideas I got from the Plenary Foundation really put me up. And we had a vaccine champion, and I've recommended to the district, to the area council in the Federal Capital Territory, that resolution of hesitancy and even forestalling hesitancy could be achieved with absolute community engagement, which has been lacking in the immunization landscape in this country. So if we engage the community and let community participate actively in immunization programming in the country, I believe that we don't have any problem spending money. People always say there's no money. We don't need funding for parents to take up responsibility and take care of vaccines that do not need injections. The oral vaccines will be given by parents. So I want to thank you.
Thank you very much indeed. We now have to shift to the next session, but we heard one Nigerian voice. We will be launching the Immunization Collaborative this afternoon during the 50th anniversary of EPI, and very proud to be doing this with UNICEF and MPHCDA. Warm welcome to you to this special session of Teach to Reach 10. This is really about health workers sharing experience. We are now shifting to the front lines of climate change and health. And this is a session many of you have been waiting for. I'm going to once again explain and recall why the Geneva Learning Foundation, having worked with you to build this global network around immunization. Last July, we launched a call to action around climate and health, asking you for your observations of what is changing in climate and how is it affecting health in your view. And within 10 days, we had 4,700 people respond. That community has now nearly doubled in size. And when we asked you last July, is climate change a threat to the health of those you serve and why? We had this, what best describes our relationship to the community. Most of you said you're part of the family or a trusted friend, and most of you said you worry about climate change. So let's start there. Is climate change a threat to the health of those you serve, and why? We'd like now to turn to those of you who are in our Zoom studio to raise your hand or just share a comment in the chat. If you're on the stage, let's go have a look there to see there are new messages coming in. This is where most Teach to Reach participants are. So let's see, we have Dr. Obina Ibirim, Margaret Rukindo says it's been a nice and insightful event and have learned a lot. Thank you, Reda and team. Thank you. Back. This event is by you and for you. It doesn't make sense without you. Habinda Mutaka Douglas from Zambia is joining. Al-Hari K. Bulus from Nigeria. Obia Jerry Ikwu. Chinwe says this initiative is a very good one. Thanks to Teach to Reach 10. And Chinwe, we understand this is your very first Teach to Reach, so welcome to the family. I'm hearing about it now and would love to participate on Immunization Agenda 2030 in any way that I can. She's a registered nurse and resides in Lagos, Nigeria. So now back to this question, Charlotte. Who shall we hear from first? A health professional to answer this question. Is climate change a threat to the health of those you serve?
Thank you, Reda. So I see Justine Namuli, who has already gone ahead to unmute herself. So Justine, since you're unmuted, I'll give you the opportunity to speak while I encourage others in the room, especially if you're participating at Teach to Reach for the first time. Do raise your hand and we'll be delighted to invite you to speak. Over to you, Justine.
Thank you so much. When you look at climate change, it can exacerbate like existing health threats or create new public health challenges. That is, for example, we have what we call vulnerability to vulnerability that climate change brings to humans. If someone is already exposed, like people are exposed because of their age, you find that he is someone who is working conditions, someone who works in the sun for so long, extreme heat conditions, they are more exposed to diseases compared to someone who stays indoors. You find that someone, because of adaptive capacity, if someone is not able to adapt, we have different people adapt differently. If someone is cannot really adapt because of the age, because of the income, you look at our society, the incomes that we have, they are not really good. You look at the age, you look at the access to healthcare. It can, if the adaptability is not good, people are very exposed to climate change. This is where the relationship between climate comes in with the health. If you break the vulnerability, if you become vulnerable, then you can get exposed to the diseases. If you're sensitive, for example, someone who is asthmatic and they are exposed to a pollutant, they easily get sick, and that is where the challenge comes in. So at the end of the day, we find that people die. We have illnesses, a lot of money is spent, physical trauma, stress. We have chronic diseases coming out because of climate change, and it is really affecting our health. And good enough, I'm saying in this kind of meeting, we have so many public health specialists. Because if you look at the work of a clinician, they are really packed with a lot of work. And you look at public health specialists are already there in the community. They are already community health workers. And if they can still create a model where primary health care is utilized, community health workers are engaged within the public health, I think prevention is better than cure. And if we could bring up the measures. For example, in Uganda right now, we have the GROW project that is encouraging, that is providing trees. And if we could put up trees that people can benefit from, like fruit trees, people grow them, they are enjoying nutrition and so on. I think that is all.
Justine, I have some questions for you. Did you participate in the event, in the special event on climate change and health on 28th of July 2023? Were you there with us or did you watch it afterwards?
I was there.
All right. And what has changed for you? It's been almost a year. It's been 11 months or so since that special event. What has changed in your mind in terms of how you think about climate change and health? What is different from where you started when you first responded to the call to action?
In fact, actually, I was in the community. I was doing health alone. I wasn't combined. I was doing some health because I was doing health because of my organization. It's doing health and well-being, but I wasn't considering climate change. I was doing it because I was passionate about what I saw that was happening in the community. A lot of change in the land use. So I got touched and I started working on it. But right now, I am telling you, I am seeing health as an inseparable future with climate. And I know we health professionals have a lot of role to play, because at the end of the day, what the challenges bring about is it goes back to the health workers. We are going to be having a lot of work to do if we do not engage right now.
Thank you very much indeed, Justine. And so in this session, we, of course, are going to be sharing the Teach to Reach questions. We wanted to dive in with this particular one. Let me just go through some of the changes in health. Very quickly, you can see some of them on screen. We're just going to flip through them. Some of the things that could be changing in the health of the community that you serve are shown here. Heat-related illnesses, injuries or deaths related to extreme weather events are two on this slide. PTSD or other trauma related to temperature extremes or climate stressors. Of course, vector-borne diseases here. And then we asked you about changes in the environment. A change in weather is the most, that leads to an increase in food spoiling pests. You can see some of the other changes here and here and here. And these are some of the options we gave you. We also learned a lot more by looking at, reviewing and analyzing what changes you see in the environment. Of course, the relationship, the cause and effect relationship, we did not ask you to prove it. We are interested in your observations and the value of your lived experience living as part of the communities that you serve. So we had this question in the was the first Teach to Reach question that we asked about climate change and health. Can you think of a moment when you felt heartbroken or overwhelmed by how climate seems to be affecting the health of your community? What emotions did you feel and how did you cope? This is about self-care. This is about, as a health worker, you may be affected or overwhelmed by this. We want to hear and share that too. Not only the technical knowledge to make sense of what these changes mean for health. Charlotte, who shall we hear from now?
Loretta, we have Philip King, whose mic is already unmuted. Philip, do start by introducing yourself.
Hello, my name is Philip King from Malawi. So I am working in the health sector, especially in the non-government organization. So in Malawi, we serve key populations, to be specific, female sex workers. So we just target them with services including condom distribution, how they can test themselves. But then last year, as most of you might know, Malawi experienced Cyclone Freddy. So Cyclone Freddy affected our clients, the female sex workers that we serve. As a result of this, we saw a surge in the number of cases of STIs. This is because the female sex workers, their businesses was disrupted by Cyclone Freddy. As a result, they started scrambling for customers, and then some others opted to do raw sexual intercourse just to get more money. So this was because of Cyclone Freddy, which affected their business. So if you ask if climate change is a threat to people we serve, I would say yes. Climate change is a threat because it has brought so many negative effects, including disrupting businesses of the people that we serve, which has led to a surge in sexually transmitted infections, among others. So I think on my part, it is great to have this platform where we can share our experiences and at the same time to learn from others how best we can tackle these issues. As of the moment, me and my organization, Better Life Trust, we have incorporated the help of female sex workers to try and tackle the issue of climate change. So by that, we are into planting of trees so that we can at least mitigate the impacts of natural disasters on our environment and also to challenge this climate change. Thank you so much.
Thank you very much indeed, Philip.
Thank you.
And I have to ask you, Philip, so in response, in terms of how your organization supports sex workers who've been affected by the consequences of this extreme weather event, can you tell us a little bit about anything that you have found effective, that if you were talking to a colleague who is facing the same issue, what would you tell them? What would be your advice or your guidance?
And Philip, you have to unmute yourself.
Yes. All right, we may not hear that from Philip. Philip, if you could answer that in the comments, and I hope that you'll be okay. Philip, is there anything you'd like to share about the response, how you've been able to respond and provide support in your organization?
Yes, so first of all, we try to link the female sex workers to the hospitals so that they can at least get the services they may need, including ART or other medication for STIs. That is first on STIs. And when it comes to climate change, that is when we are trying as much as possible, maybe to find partners so that we can teach the female sex workers on how they can respond when climate change affects them or in times of distress. So yeah, that is what we are doing on the ground currently. And I'm sure on this platform, we will learn much on how we can help these female sex workers to at least to adapt to climate change. Thank you.
Thank you very much, Philip King. And many stories already being shared across in the conference and across the platforms. So just go have a look here. So Chinwe, first-time Teach to Read participant, says, of course, climate change is a very big threat to the people I serve as a nurse. It brings about exposure to a great number of people in a way that is hard for government to give a quick help. Right now, Nigeria is battling cholera, which of course is as a result of climate change, says Chinwe. The too much rain and flooding affects our water supply, our agricultural proceeds, not to talk of the malaria issue. So back to you, Charlotte. Who shall we hear from next?
You right now, Red, I think Obina Ebirim, whose mic is already open.
All right, thank you, Charlotte. Thank you, Reda, and good morning to colleagues on the call. So I work in trying to reach zero-dose children across various African countries, including Nigeria and DRC. And I would say that climate change is real and it affects those that we serve in many ways, some of which are, as mentioned by Reda Chinwe, there is increased burden of some vaccine-preventable diseases, including malaria, which we have a vaccine recently, but also meningitis. But then more importantly is that we're seeing drought, we're seeing in some cases flooding that is causing some population to migrate. And when people migrate, it's difficult to trace, to track those defaulters and then reach those zero-dose because they are now moving from their initial place of residence. Also, we've also seen where climate change has caused drought and now caused conflicts with pastorates and farmers resulting to security challenges in some parts of Nigeria. And because of that security challenges, the population are unable to access immunization services, leading to increased number of zero-dose children. We've also seen situations where sometimes when you get the zero-dose children, but during the peak of rainy season with the climate change causing flooding, disrupting health services, these children cannot then access services because service has been disrupted by flooding. So these are some of the ways that climate change is affecting some of the zero-dose children we try to reach and bring back to the health facility to assess vaccination. And also, as I mentioned earlier, increasing the burden of some vaccine-preventable diseases, just similar to what Chinwe mentioned earlier on. Over from my end.
Thank you very much, Obina. Ibrahim, a question for you then. Amidst these challenges, your work focuses on reaching zero-dose children. What gives you hope for the future? Do you have something that you would like to share that gives a glimmer of positive change you've witnessed in your ability and the community's ability to respond to these changes and the impacts on health?
Yeah, so I think that when you look at the powerful effect of vaccines and other preventive medicine in trying to save life and in saving lives, it gives you hope, it motivates you that if you have such a powerful tool amidst the challenges of climate change, how can we then work to overcome these challenges and make sure that these children get vaccinated? Because if you're able to surmount these challenges caused by climate change, you're then going to save a lot of lives. So the thought of the amount of the number of lives that you can potentially save by ensuring that these vaccines or the health services reach these children, it's a huge motivation to overcome some of these issues around climate change. As I mentioned, if it means going to the displacement camp to reach these children with vaccination, we do that. If it means then supporting more outreaches where the services has been disrupted in health facility, we'll try to support that because we know that we really need to overcome these challenges and get these vaccines and save a lot of lives. Over.
Thank you very much indeed. Charlotte, how is climate change hurting the health of your community is the question up on screen. Who shall we hear from next?
So we have Juanita Natsima that indicated in the chat that she had something to share. Her mic is unmuted. So Juanita, we are listening to you. And do start by introducing yourself.
Hello, everyone. I'm called Nasima Juanita from Uganda, and I'm a health worker, midwife. Climate change, I'm going to talk about climate change, especially in this side of Uganda. Climate change, especially the dry season, has contributed to a lot of dust in this country, whereby many sicknesses have come out, especially respiratory tract infections like coughs, flu have become common because of the climate change. Thank you so much. That's what I could say.
Juanita, can you tell us what you do every day and how this affects you?
What I do?
Yes, what is your work or your job?
I'm a midwife, health worker.
Yep.
And we work on many people in the clinic, hospitals.
And is there a way in which you see extreme weather events, extreme heat, or other things that can be linked to climate, to change in climate over time? Do you see how are these different issues affecting the health of the pregnant women and the babies too that you serve as a midwife?
This climate change is affecting pregnant women in the way that most of them get flu and cough.
Yeah. And can you think of a situation where that was particularly difficult for a woman you were attending to?
Sorry?
Can you think of a situation, of a time when a woman who is pregnant that you were seeing in a visit or during childbirth, where things were made much more difficult because of extreme weather or other things that can be linked to changing climate?
Yeah, most of times those pregnant women cannot access the medical facilities, especially when it is rainy season. So most of the time it become too hard for them to travel, to move from their homes to the medical center, to the hospitals for treatment.
Understood, Juanito and Nasima. Thank you for sharing your experience. We're going to soon be moving into a networking session, and there you'll be able to share your experience with others in one-to-one meetings. We'll explain how that works in a few minutes. Charlotte, back to you.
Thank you, Reda. So I'm inviting Mohammed Kuresh Jimale. Mohammed Kuresh Jimale, are you able to unmute yourself? If not, we'll listen to Paraclet Ugo. Okay, Paraclet, over to you.
Okay, good afternoon, good morning, everyone from wherever you're calling from. My name is Paraclet Ugo. I work with Enugu State Primary Healthcare Development Agency from Nigeria. This is actually my first section. This is the first time I'm joining Teach to Reach. And I would also like to share my experience with climate change and how it's actually hitting Nigeria, especially those in the south part of Nigeria, through the emission of carbon dioxide and methane into the air. You know that Nigeria actually is an oil producing nation. We are still rely heavily on fossil fuel, a greener one, and is affecting people. The air that we breathe from that region of the country, you find out that most times you say you close your room, maybe you travel for like a week or 2 weeks, and when you come back, the kind of dust that you see in your house will be black. That's the kind of dust that you experience when you open your door. That tells you what is already in the air that we breathe. It actually calls for concern, and I hope Nigeria will actually find an alternative source of energy to be able to move away from fossil fuel in order to reduce the effect of climate change on the health of people from the south part of Nigeria. Thank you.
And Paraclet Ugu, thank you for sharing these observations. For you as a health worker, how do you feel when you see such obvious linkage between air pollution, likely linkages to health? What does it mean for you as a health worker, and what are you doing or would you like to do in response to what you've just shared, for example?
Okay, to me, I see it as a threat. A threat has a high risk, even a risk multiplier effect. That's how I see it, because it has a link from one sickness to the other. It has a multiplier effect. And on my own part, what I've been trying to do is to advise people from the other side to always be on face masks. But the funny thing is that people don't like to wear it. When you wear, they'll be looking at you. Is this still COVID era? Are you still on COVID? But it's not actually COVID, but because they are not seeing the immediate effect of the impact of climate change. That's why they don't see the advice of going on face masks as something doable. And I hope that I'm still looking for another strategic way to get the people know the implication of the environment that we live in. Over.
Thank you, Paraclet Ugu. All right, back to you, Charlotte, for our next speaker.
Yes, Reda. So I'm inviting, there's Christopher Amalu. Christopher, your hand is raised. Are you able to unmute yourself?
Thank you very much, Dr. Redia. Thank you very much, Maria and Carol, for coordinating this program. Particularly, I'm glad to be here as one of the Teach to Learn partners. And thankfully, one of the people I referred here, the last speaker, Dr. Parakret Ugu, is also, I'm glad to see her presentation. And myself, I'm the program director of the Royal Healthcare Foundation in Enugu State, Southeast Nigeria, a public health and development expert. I would like to present something with regards to climate, impact of climate change on health of the people living with HIV and vulnerable children in the Southeast Nigeria. We know the climate change is increasing poverty and malnutrition in the sub-Saharan Africa. And according to WHO, you can see malnutrition refers to deficiencies and imbalances in the person's intake of nutrients. So you will find out that here in the climate, in this part of the world, in the Southeast, the delay in the onset of rainfall, which usually occurred during February, early February, but now we'll find our first rain around April, May. So it decreases the access to very important nutrients like vegetables and fruits, which is very important in increasing the immunity of our people who are already immunosuppressed, especially the community I serve, the people living with HIV and AIDS. So this is a troubling situation. And one of the challenges that has also heightened this is that there is inequity. This community of people living with HIV and AIDS and their vulnerable children and their caregivers, we don't have enough funds or money to, buy these vegetables at the market at that high cost. And even the farmers, because of the delay in onset of rain, when we now start having this rain, you find out that it doesn't come gradually the way it's supposed to come. You see an intense rainfall that doesn't support the growth of vegetable. So my mitigation with this more so is that it has also exposed this community of persons because they don't have adequate supply of these micronutrients. It will deplete their hemoglobins and immunity. More so with the onset of rainfall, they will be exposed to mosquito bites, and this also increases their risk of being down with other complications due to severe or uncomplicated malaria. So one of the key mitigation strategies is that state actors and non-state actors, government being responsible, should support small household farming of vegetables and fruits to augment the source because of the high cost of these vegetables. It's unbelievable that with inflation in this country, fruits that used to go for 50 naira is now sold for 300 naira. Is about 600% increase. So it is worrisome, and something has to be done urgently to actually contain the impending threat. Thank you very much. And
thank you.
More so is that
I encourage you to focus on your personal experience rather than your opinions or general considerations. We find that to be the most useful for your colleagues to learn from things you have actually done and carried out and what happened and how they turned out, rather than more general opinions, which can be very interesting, but which are not really then about sharing experience. And speaking of that, we have Bello Arkilla Magaji, who's asked to speak because Bello is a vegetable farmer and wishes to share some experience. Bello, I hope that you're able to unmute. And we will... All right, we're asking you, so that means you have to go to Zoom and find the button to unmute. Otherwise, you won't be able to speak. All right, Bello Akila Magaji unfortunately is not able to unmute.
Very good morning. I out with the interest.
Yes, go ahead. Oh, it looks like we did hear someone. Charlotte, do you are you? How is your connection?
Yes,
if you
it's
give me,
Mohammed
I could
Quresh
appreciate.
Jamali.
Yes, go ahead,
Yes,
Mohammed.
thank you very much for giving me this. I think you are hearing me very well.
Loud and clear. How is climate change hurting the health of your community? But don't forget to introduce yourself first.
Very interesting. My name is Mohammed Quresh Jamali. I'm from Ethiopia and I'm working as a project manager, BSF Swiss, in Modena Triangle, where by both Kenya, Somalia, Ethiopia. So, like, just to go quickly, one challenge big we had is the issue of malaria, and that actually it by when we distributed the net and everything, still the community complaining because it by the daytime while they are sitting and just due to that now. I think the Geneva, which strategy or modality could help all my colleagues in their experience. Of course, by giving net everything, still this thing repeated. Thank you. Over to you.
Okay, thank you, Mohammed Quresh Jamali. Let's try Bello Arkila Magachi again. Bello, are you able to, you said your network went off. Okay, and here is, you've typed in, yes, go ahead. And do tell us.
I said, hello, I'm with you.
Yes, go ahead.
And the climate change effect is quite real and a big challenge because this last dry season farming we were unable to do it because of the scarcity of water, but the rainwater as well as the groundwater. So that really affects the availability of the vegetables, especially the onions that we farm, and also some other green vegetables around. This is a real thing, and effort needs to be made to address that. And also we have a challenge recently, a cement factory in Sokoto, a very large cement factory called Bua Cement. They were mining the limestone for their production, and they were excavating a very large area in Sokoto. So we're thinking about how best can we approach them to reclaim the land so that the effect of those minings on the availability of groundwater in the nearby communities will be addressed. Thank you.
Thank you very much indeed, Bello Arkila Magaji. We had a more technical question amongst the Teach to Reach questions. So let's say a little bit more precise. Again, for example, saying responding climate change is a health risk to communities is an opinion where your experience as a health professional can make the difference. Is that what have you actually observed? What is different now than it was then? What are you seeing in health and in climate that has changed over time? And if you think they're linked, you don't have to prove it at this point, but we trust your lived experience, and that is what we're interested in learning from. This is not a general debate about climate change and health. So hence this question, describe a situation where extreme weather directly influenced the spread of diseases in your community. So this can be an extreme weather event, extreme heat, but also extreme floods. What actions did you take in response as a health professional, but also as a family or as an individual if you were affected by this extreme weather? What have you done to better prepare for the next time that this is going to happen? So we're going to turn, Charlotte, to our next speaker.
Yes, Reda, and that will be Rukaya Mumuni, whose hand is raised and mic unmuted. Rukaya, over to you.
Okay, thank you. Hello, everyone. My name is Rukaya Mumuni. I am joining from Ghana, and I work with Ghana Health Service, and most of my activities are with regard to vaccination. So I want to share my experience about climate change around vaccination activities and how climate change is affecting vaccination in Ghana and in the communities that I work. So for the past few years, we have been experiencing rains, irregular rain patterns, and these often result in floodings and cutting off some communities. And where we work or do our vaccination activity, mostly in Ghana, we do some of our outreaches in open spaces or under trees because we want to be able to reach a lot of people. And during these periods, when we have
Go ahead, Rukaya. One person
Yes,
unmuted their microphone.
Yeah. So when we have these rains, we have some of our immunization activities disrupted. We cannot go for outreaches, and some communities are often cut off due to the flooding in those areas, and most of the roads become immotorable. And this is often a challenge that result in some of our activities, like cutting some of our outreaches to be able to reach some communities that are not closer to health facilities. And for some time, it has actually resulted in our coverage. It has affected our immunization coverage. And to just give some figures from 2021 to 2023, we had 90.4% for Penta-3, and then 2022 we had 89.1%, showing that there was a decrease in our Penta-3 coverage. And then for 2023, that is our annual coverages for our sub-district. This is not a broader coverage. It's just the area that I work in Ghana, and it is a sub-district, and it's a continuous challenge that we are observing, and it's actually linked to utilization of immunization. If these rain patterns continues for long time, women or caregivers are not able to come out, and health workers are not able to go to outreaches because we cannot go and sit under trees where we don't have shelters, and it is seen in our coverages for some time now. And this is has resulted in some of outbreak of vaccine preventable diseases. For last year, for instance, we had suspected cases of measles, 29 suspected cases in just our sub-district, and we had one confirmed case of measles. It's actually an implication that we are facing challenges with regard to immunization, and this is partly related to climate change, the rains and the flooding issues in those communities. Thank you. This is just an observation I have seen in the sub-district and an experience. Thank you.
Rukaya Mumuni, I have to ask you though, we know you as a very committed and dedicated immunization leader. As you've been thinking, obviously, about these impacts of climate change on health and how it's affecting your immunization work, I imagine you're already thinking about what you can do about it. What do you have in mind? Anything specific, actions that you have taken or would like to take in order to respond to these kinds of changes?
Yes, so we at our level, we have activities that we can do to be able to mitigate some of these challenges. So in order to be able to reach out for children that have made vaccination, we normally organize mop-up activities, regular mop-up activities to reach out for children that have missed due to some of these disruptions. And the other thing that probably is beyond me, or that I want to advocate for, is for us to increase health infrastructure. If we are able to have health facilities in some communities, it is actually going to reduce some of the challenges, the climate challenges that we face. We have health centers that we can go, and health workers can go and sit and then provide immunization or provide health services or close to communities that they are able to access basic health care. Is going to be able to mitigate some of the challenges that we face as a result of climate change.
Thank you very much indeed, Rukuya. Now, I'd like to show you little bit of what. This is a draft document, and every Teach to Reach participant will be receiving this collection of insights, of experiences shared on the front lines of climate change and health and on the other topics, because remember, we are going to deep dive on malaria and then on neglected tropical diseases, or I think actually it's the other way around, but we're going to cover and invite you to keep sharing your experiences. There'll also be an option to go off and network, but it feels to me like, given the numbers of hands raised in this room, that we should probably extend this session when we get to the top of the hour. We'll ask you that if you'd like to extend, so that more people, more voices, more experiences can be shared in this space. You can see here, these are organized by country. You can see some of the names of the Teach to Reach contributors that we honored previously. And I believe there are literally hundreds of contributions on the front lines of climate change and health. Some are very short, some are incomplete and will not be recognized ultimately by our insights team, but so many are detailed, and you can see some of them here have gone up to Ghana. Back to you, Charlotte, to guide us to our next speaker.
Loretta, our next speaker is going to be Samir Rogo, whose mic is already unmuted. And please do start by introducing yourself.
Hello, everyone. Good morning. My name is Samir, and it's not been here. This is the first time. And I work as a field officer with a new incentive US-based organization that specifically work on children that mitigate the immunization here in Nigeria. So my insight about this the climate change is that we in Nigeria, specifically the northern part of Nigeria, we face so many issue of weather, and this happen as a lot of we are not planting trees. There is there is a lot of companies. There is a lot of carbon dioxide in the air, carbon monoxide, and a lot of things happen to complicate our environment, and that's all. And again, companies mostly produce these fossil fuels, and the air pollutant we breathe. It is obvious that one of my colleagues shared that if you close your room in Nigeria, specifically here for just 2 or 3 weeks, when you came back and you find doses everywhere, this is telling you how the air we breathe. And it is obvious, quite sure, that we are taking air pollutant. So that's all I can say. Thank you very much for being here, and it's a pleasure being here and speak on this meeting.
All right, thank you very much indeed. Charlotte Bridget Udo Aka has requested to speak. There are probably others who have done the same, but who shall we hear from next? And just wanted to highlight her request to you.
Okay, so Bridget, you have the opportunity to unmute, but I'd like us to listen to Dr. Khalil El Natik first. Dr. Khalil, and please be specific. Describe what you have experienced. Here is a situation where extreme weather directly influenced the spread of disease in your community. And do start by introducing yourself. Dr. Khalil, you have the floor.
Yes, Reda, I am Dr. Faisal Parvez. I have written Dr. Khalil. I am Dr. Faisal Parvez from Saudi Arabia, team leader in National Tuberculosis Control and Prevention Program. So my concern is that heavy harsh climate in Saudi Arabia desert, it may increase the spread of the tuberculosis, communicable diseases. So we need to make lush green. We have to create an initiative for the green Saudi Arabia. Like that, I have created a national level green Saudi Arabia. It is around 2,000 planting trees, 2,500 kilometer planting trees, so that it will benefit for the diseases and healthy of the people. So we have to concern about the BCG vaccine. First vaccine will be world will be given the BCG. Even in spite of the BCG, we have noticed some few active tuberculosis at the age of 20, 15, 17, 20 years. So because of this harsh climate, it may aggravate. So to cool this hot climate, we initiated a green Riyadh, and government also supported, and whole Saudi Arabia we are initiating shortly. 3-4 years we have made the desert with the lush green forest. Thank you. Over to Rida, Charlotte.
Thank you very much indeed, Dr. Parviz from WHO. I'm pleased to share that Dr. Maria Nera from WHO, who leads on climate change and health, has joined us in our Zoom studio. We're going to ask her to listen to perhaps a few more of these experiences that are being shared by health practitioners from all over the world, and then we'll ask her to share her reflections. When she listens to what you are sharing, as she is one of the key people at the global level, really bringing attention to this question of climate change and health. We'll ask her for her insights and feedback. So Charlotte, who shall we hear from next?
Okay, right now we have Esther Yakubu, whose mic is already unmuted. So Esther, we are going to listen to you right now. Afterwards, we'll listen to Bridget and then Fatima. So Esther, you have the floor, and do start by introducing yourself.
Thank you very much. My name is Esther Yusuf Yakubu. I work with Health and Development Support Program based in Jos Plateau State, Nigeria. My contribution or my take up on this subject is I observe the climatic change in my own community in the aspect of people keep falling sick with malaria over. Some person can have malaria now. After treatment, maybe a week or so, he's down with malaria again. And my little observation in my community is, one, sanitation practices is very poor. There is a lot of drainage with dirty, which gives room to the development or growth of these microorganisms, and also people being infected. And what I decided to do as a health personnel, I encourage them to keep their environment clean. That is one. Secondly, because the climatic change is affecting the air we breathe, and people are fond of burning bushes in order to make firewood, to get charcoal and other things, I tried to encourage them to minimize bush burning and to plant more trees. If you cut down a tree, try to plant either 2 or more. That is in the aspect of trying to see how we can control the climatic changes that is affecting our health. And another aspect, there's a question.
Oh, it looks like we just lost Esther. Charlotte, can you confirm?
Yes, Reda, that's the case.
All right.
We just lost.
And yes, all right. So we are. We're technically 12 minutes away from going into networking. I'd like to propose, and please, we're going to ask people, so if you're watching on YouTube, Facebook, Twitter, across the internet, wherever you may be, or if you are on our conference platform, which is where most of the Teach to Reach attendees are, please type yes into the chat, wherever you may be, to let us know if you'd like to extend this session so that we can hear more voices. Of course, some of you may choose to go off and network. That is what Teach to Reach is all about. But if you'd like to hear more voices and more experiences being shared, all right, and I see Maria Nera from WHO has in fact also voted in favor, Nduka Ozor, Sharon Aguti, Lenora Eminari, Professor Abubakar Jafar Usman. So, all right, wonderful. Let's keep going then, Charlotte. I'm sorry for Esther. This happens, and this will happen to everyone. All right, and thank you for so many of you to respond. We're definitely extending this session, I think, Charlotte. We have to. So back to you.
Definitely, Reda. So I'm turning towards Boniface Cosson. Boniface, your mic is already unmuted. I'm trying to apply our rules of fairness. So please do start by introducing yourself, and considering that there are many raised hands, go straight to the point and share your experience after your introduction.
Thank you very much for giving me this opportunity. My name is Boniface Cosson. I am the Chief Executive Officer of Youth Progressive Association in Taraba and the State Coordinator, Society for Water and Sanitation, Taraba State Chapter. I would like to share some experience about the climate challenge in my state, that is particularly in my jurisdiction, Taraba State particularly. Changes in climate change have caused decreasing for some crops, resulting in high food prices, food insecurity, and undernutrition, which leads to malnutrition and sometimes result to kwashiorkor. Climate change has also caused water security in Taraba State particularly, and in some part of Nigeria. We are currently having an outbreak of diarrhea in Nigeria in some part of a state, which causes as a result of a waterborne disease. This is due to the scarcity of water we're experiencing in some part of Nigeria. We are experiencing, especially this year, that is climate change for you. You may be aware that the symptoms of this diarrhea disease typically include fever and other signs. These factors of climate together can lead to increasing poverty, human migration, violence, conflict, and a mental health issue. As a state coordinator, Society for Water and Sanitation, I happen to be opportunity that makes me to address some challenges caused by climate change in Taraba State particularly, and other parts of the state in Nigeria. Research showed that health professionals around the world agree that climate change is caused by humans and is causing increased health problems in their communities. Study also showed that taking action to address climate change, improve public health professionals can act by informing people about the health harms and ways to address them. The lobbying of leaders to take action is one of the key area that can be able to address climate change in our community. Thank you. Because of time, I would like to stop here.
Thank you very much, Boniface Kozon. Charlotte, back to you. Maybe we'll hear one more, and then we'll ask Maria Nera from the World Health Organization, who's joined us now and who's listening in, to health workers from the front lines of climate change and health, sharing their varied experiences. Most of the people now, a few may be climate experts in some way, but most are health workers. Many work in immunization, and all responded to the call because of their concern of the impacts of climate change on health that they are eyewitnesses to. So back to you, Charlotte, for one last experience before we go to Maria Nera from WHO.
Yes, Reda, and it's going to be Muhiwe Ronald Zion, who already has their mic open. Over to you, Ronald.
Okay, thank you, Charlotte and Reda Sadiq, for this opportunity. I'm called Ronald Muhiwe Zion. I'm a public health specialist, director of APSES, that Association for Promotion of Education Services in Uganda. But the climate change, an assessment by the climate change experts at the Ministry of Water and Environment of Uganda indicated that the climate change is one of the main drivers for the malaria, and the malaria burden will increase in relation to the rainfall change, temperature increase, and population growth, and which will lead to the significant cost. Are we together? And moving on
Ronald, can you be a little bit more audible? Can you be a little bit more audible and share specifically a moment when you felt heartbroken or overwhelmed by how climate seems to be affecting the health of your community?
Yes, my heartbroken was one day in my community where I do stay. It rained at night, and the drainage overpowered water into the communities, the houses. So it was around 3 a.m. where most of the community members stood up. They did not have a sleep for almost 3 days. It was a my heart moment that I felt very touched, and I could also raise more voices on how at least we can tackle this issue. Now with Teach to Learn, I'm getting more experience with some things on how at least I can address the same issue, even together with some other touched members, so that we can get a solution.
Thank you very much indeed. Now, a reminder, many of the issues that have been mentioned, malaria, heat stroke, asthma, malnutrition, waterborne diseases, these are not new, and all of them can happen without the climate changing. So that is something for your consideration when making that linkage. But of course, as a health worker, your priority is whatever the cause is to respond to the health needs of the community. Charlotte, I think, what should we... Okay, I see we also have been joined by Ravati Falki from Save the Children International. So very pleased to have Ravati join Maria from the World Health Organization. I know that both of them were just a couple of weeks ago at the 77th World Health Assembly, speaking and engaging with ministers of health and other global leaders on this issue of climate change and health. Today, they are with us to listen to you and your experiences on the ground with the changes that you are seeing and responding to. So first of all, a warm welcome to both of you. And we'll start with Maria Nera. Of course, this is, we don't know who is going to speak. We know we're not sure what stories they're going to bring to Teach to Reach. You heard a few, and they're part of a larger collection with thousands of health workers who've shared their insights. What, at this stage, after having heard just a few voices, would you like to say to the health professionals assembled here today for Teach to Reach 10?
Thank you, Rada, Charlotte, and dear frontline health workers. A very, very warm and hello to all of you, and thank you very much for this amazing engagement. I was fascinated to hear many of the stories that you have been able to describe, and they are all, I'm afraid, very consistent with what we hear around the world on the how climate change is affecting your daily work and how this will be deteriorating what we have been doing together for many years, trying to increase our capacity as the healthcare facilities to respond to the needs of our citizens. Unfortunately, climate change might be the one that now sends us back a little bit on public health, and we are not ready to accept that. Positive things. We have developed a package of interventions for healthcare facilities to look at water, sanitation, waste management, hygiene, electrification with solar panels, and of course, looking at the issue of climate resilient healthcare facilities. I will be very happy to the Teach to Reach, which I found fascinating, this platform, to share this package with you, because I think you can have some responses to that. On the other hand, I'm sure that all what you have described is what we call the need for adaptation to climate change. Adapting to climate change means exactly that. Having better trained health professionals, so you, having more vector-borne control activities, going back to the stagnant water, making sure that we have a good epidemiological system for those climate-sensitive diseases that we will see more and more, access to safe water and sanitation, investing on basic public health interventions that are the ones that are not only preparing us from a climate resilient healthcare facility, but in addition to invest on this primary prevention approach. This is the message we are always giving to our people at the global level, saying investing on adaptation is nothing else than investing on basic primary public health measures, primary prevention that we all need, that our frontline workers are telling us that is so fundamental. So your voice, I don't know how, but we need to collect your voice and take it to the global level at the COP29, when there will be discussing about financing and the importance to invest on the peripheral healthcare facilities network, the health workers, the frontline, because you are the ones that are already receiving the negative impact of climate change. Of course, we need to work as well on mitigation. And then again, the health argument, making sure that if we tackle the causes of climate change, the results for our human health will be enormous, reducing the toxic air that we are breathing now, which is killing 7 million people every year because of air pollution, and making sure that we transition from the fossil fuel combustion to something that you as the frontline workers, I'm sure that you will be convinced on it. There is no reason why we cannot have a solar panel, a functioning one, a sustainable one in every single healthcare facility to avoid the use of diesel generators, which are very expensive and contributing as well to the non-environmental sustainable that we want. Many interventions that we all need together to put together, but your voices on how be part of the solution and raising the point that with your advocacy, that this is already affecting and putting at risk what we have been doing for many years. So it's all about mental health, malnutrition, infectious diseases, chronic non-communicable diseases, and making sure that the heat waves and the extreme weather events needs to be reduced. So only the health community and the health argument is the one that is gonna win. So your voices and this initiative of putting this platform together to hear your concerns and your experiences extremely valuable, and is goal for making and moving the mountains we need to move when it's about allocating the financial support for reinforcing our health systems. Thank you so much for this opportunity. Keep fighting, don't give up. You are the front lines. In addition to work with your communities, make sure that you engage with others to do awareness raising, and make sure that your voice will be joined with others in creating this mountain of arguments that we need to mobilize resources and more action to tackle the causes of climate change. Thank you all very, very much for your amazing work.
Thank you very much indeed, Maria Nera from the World Health Organization. One question for you. We hear from these sessions like this one, sessions like the one we held last July, a sense of urgency of health workers doing what they can, but primarily doing so alone. And these are not the climate specialists. These are immunization staff. These are other primary healthcare staff. And yet, when we speak to some folks at the global level, we hear a sense of a kind of hesitancy. Are we really sure what the support needs are, what the urgency is? What are you in a position to say today from WHO's perspective to health workers gathered here today? Are there concerns about the impact of climate change on health legitimate? Should their action at the local levels be supported?
Legitimate, 100%. I think the evidence is now absolutely very, very strong. No excuses for public health officers at the global level or for policymakers that there is no evidence. There is more than enough evidence and legitimacy for the health sector to be part of this discussion. Urgency, only the public health community can bring this sense of urgency, because the negotiations, as you know, at the COP, they are now taking COP29, which means that they have been negotiating for 29 years. You will never do anything like that on a public health issue. So the sense of urgency will be provided by your voices. And this is what we are trying to do with the global climate change and health resolution approved by the World Health Assembly, going to COP, making sure that last year, thank you very much, making sure last year we have the first ever health day at the COP28. We are working now very hard with the COP29 presidency to make sure that our space will grow and be even more impactful. So don't give up, because only the health argument, the health community, the health professionals that are the ones that are suffering and arguing and presenting these strong health consequences, maybe this is the only way we will be able to generate more sense of urgency at the COPs and other mechanisms where the decisions are taken.
Thank you very much indeed, Dr. Maria Nera from the World Health Organization. Now, we made the decision to extend this session, as you can see here. I hope you can still hear me. We made the decision to extend this session so we could hear more experiences shared, listen to more voices given the number of our guests of honor invited to our Zoom studio, but also online from all over, health workers sharing ideas, comments, sharing their concern. So for those of you who would like to go to the networking session, I encourage you to do so, to go to network, in fact, on climate change and health. And just as a reminder for those of you, especially for those of you who are joining for the first time, this is how it works. You click on join now, and this will connect you with someone else. You, of course, need to allow your comment and so on. In my case, it may not, and then apply the selection. So you may get asked for authorizations. It's a secure system, so you can go ahead. And once you've done that, you connect. It may take a few minutes, as it says, for another person to arrive. And as soon as you do that, then you'll be talking to someone else, another health professional participating in Teach to Reach. We encourage you to start on the topic of climate and health once you have met. And from that point on, of course, you'll be able to have a 15-minute conversation. And after that point, then it's up to you whether you want to extend or not. If you have connectivity issues, we recommend you turn off your webcam and really get the most out of it. If there are any issues or concerns in these networking meetings, let us know as soon as you can. So now, Charlotte and Maria, back to you. We're really eager, and I'm actually really excited to hear this many stories. It's more than we were able to hear last July. So back to you to tell us who shall be our next speaker.
Okay, Reda, I am inviting Daniel Katete. Your hand was raised, has been raised for a while. Daniel, are you able to unmute yourself? And also Fatima Zara, sorry, earlier on we were not able to listen to you. So Fatima, please go ahead and unmute.
Hello. Hello, everyone.
Yeah.
Can you hear me?
Loud and clear, Fatima.
Okay. I want to talk about describing how climate change has really affected me and my community in regards as from a health educator perspective. Can you hear me?
Yes, go ahead. And we're looking for your personal experience, things you have actually done, seen with your own eyes, carried out. And of course, we're interested in how it turned out.
Yes, from my own personal perspective, from my own experience, the effect of climate change has, at first we noticed some of the students were no longer coming to school. And we thought maybe they were just pretending to, using the heat as an excuse, as we used to tell them, we experienced the heat and we made sure we didn't miss any of our lectures. But unfortunately, we went to go and check on them and realized they were truly affected. Some had heat stroke, dehydration, malnutrition, especially due to the erratic electricity supply and inflation rate, poor economic situations of most of the students, and the high price of quality food and low rainfall for them to even self-cultivate their foodstuff. And even if we are going to talk about the high price of foodstuff, it's still climate change is still responsible for most of them, because we've not been able to cultivate our crops as a country as a whole. So unfortunately, this climate change really affected them, and to combat this, we had to take some of the students to go and be receiving classes outside, and we reduced their class time because most of the time at the end of the day they'll have to have lectures to up to 2 p.m., 3 p.m., which is the peak of the heat. So we made sure, okay, they came earlier, which is like from 7 o'clock or 6:30, as early as possible for them to have their lectures. Yes, they had to make sacrifices, but we also had to make sacrifices. They came early and we finished early. By 11, 12, they were all done and they could go back home. And this also motivated their parents to allow them to come to school. We, as educators, we complain that the motivations of students to study and the decline in academic performance is because they are no longer studying. But we can't deny the fact that climate change too has an impact. in this situation. We can't keep blaming everything on the students, saying that they are not reading and everything. Circumstances need to be convenient for them to study. Yes, the decline in the ability for stress threshold for most people has really reduced, but we can't force people to endure the stress just because we were able to enjoy it back then during our time as students. Now things have changed. Now things are improving. Now the climate change is more negatively impactful. We can't deny that fact. So all this has been what we have experienced and how it has affected students in regards to their health. Yes.
Thank you very much indeed, Fatima. Obviously, some implications for education systems and for pre-service training, given the impact of climate change on health. Back to you, Charlotte, for our next.
Thank you.
Reda, we have Daniel Katete, but I also just wanted to call your attention to the Q&A where we have some questions, and particularly one for Maria Nera. So we have Daniel Katete. Your mic is unmuted. Daniel, over to you.
Hello, everyone.
Yes, Daniel, please, can you speak louder and closer to your microphone?
Hello. Hello. I hope you hear me.
Yes, Daniel, please speak really into your microphone and speak really loudly as if you were on a stage or something.
Okay. I'm Daniel Katete from Youth Action Against Climate Change, Program Manager for Youth Action Against Climate Change. As for the climate, how climate change affected the community, hope in doing a lot of things related to climate change in our area here in Malawi. As you know, just recently, we have Cyclone Freddy, which affected a lot of Malawians in terms of health. So, as our organization has been doing a lot to mitigate some of climate change challenges. In most cases, we have a lot of outbreak like malaria and other communicable diseases, which affected a lot of health department and other related department. As you know, climate change is a sexual issue, intercourse, which affect a lot of programs in life of the people. So, as a climate change, as a youth action against climate change, we have a lot of programs that we are implementing just to make sure that the people are saved from climate impact. Now, we are encouraging youth to participate and adapt to new technologies in terms of use of new technologies in terms of using way of doing their day-to-day life in terms of to focus on mitigating the effects of climate change. We sensitize the community on the hazard or effects of climate change. We encourage the youth to take part in most cases of immunizations and other programs that are related to mitigate climate change, like planting trees, using other resources for energy like electricity, gas, and new technologies that are able to mitigate or to avoid deforestation that is highly in Malawi. That's what I wanted to share.
Okay, thank you, Daniel Katete. It sounds like you're doing important work with supporting youth and sensitizing them on these on these issues. Now, we have with us Revati Falki. So for those who have not met her yet, she is a longtime advocate of this focus on climate and change, and also an advocate of maternal, newborn, and child health. She is currently with Save the Children International. A warm welcome to you, Revati. You've been listening. And we need to change, of course, your name. We did a lightning chat that was lightning fast and just left us thirsting for more. You've heard now a few more stories from a collection of literally hundreds that have been shared, experiences shared by health workers in very, very different situations and with very different but also similar challenges. After having heard a few, what's on your mind and what would you like to share back with this community at Teach to Reach?
So first of all, I would like to say thank you for the opportunity to join in and to listen, because this is my first experience of probably the second one, and after the lightning chat, to kind of listen to real kind of narratives of how frontline health workers are dealing with. And what I liked about all of the inputs that have come from colleagues so far is that they are all solution oriented, and I think this is the direction that we should all be thinking of. And as Maria said, it's very difficult to go after Maria, and just as she outlined, right, the challenges are here. It's only going to get worse. And here's the evidence, right? Like that we are seeing it from every corner of the world, every healthcare facility, every program is kind of, bringing forward that evidence on the range of impacts that we are seeing. So this is also our opportunity to crowdsource some of the solutions that colleagues are testing. Yep. And I think the role that frontline health workers play are three, in my opinion. The first is to tell us, because we know that business as usual is not going to fly anymore, to come forward and tell us how they are dealing with the same health conditions, with the same diseases differently. Like, how are they making those, what changes are they making, at what scale, which is kind of, helping them respond to the excess burdens, that additional burdens that we are seeing from climate change. That is a very, very critical role. So it may not necessarily be innovations, but it is doing things differently in the same system for the same diseases and convincing people to kind of do that. The second key role I say that I think that colleagues are playing is that by responding to them effectively, responding to the health impacts effectively at the community level, they are supporting scale. And that is what we need right now. We need action at scale. And as Maria outlined, because of the urgency, we also need the speed. And the speed is going to come if everybody online brings in, other colleagues, share the information, exactly the objective of this exercise, that bring in people, share the information, learn from each other, and put in as much force as possible into responding to this urgency that we are seeing. And I'll end with just saying one thing, that we know that known interventions will not behave the same way because of the concurrent impacts that we are seeing of different exposures from climate change. So we do need to think differently, and we do need to gather that critical evidence from colleagues at scale on how to optimize our actions in a more coordinated and a more synchronized way, because that's when we are going to be able to deal with it fast enough and big enough to be able to make that dent in dealing with the climate change impacts. Thank you.
Thank you very much, Revati. And what level of interest do you think there is in listening and learning from these experiences of health workers who are not climate specialists, but who are being confronted with these changes and their impacts from the global community? Of course, you and Maria were kind enough to join us today, but what level of interest and sort of understanding of the value and significance of lived experience in a climate space that is focused on primarily focused on hard quantitative data?
Yeah, I said that even in the lightning chat, right? Like these are the faces behind the numbers that climate scientists and health scientists are looking at. So there is immense value, there is immense appetite to look at these frontline descriptions of how health impacts are being felt and dealt with. In fact, as you know, at COP28, we did launch, actually WHO coordinated a piece which was around solutions for climate change and health, and these were exactly the case studies that were collected from frontline workers in a standardized way, so that we could compare the two. So I think it's about processing this information in a certain way so that it accumulates into that evidence, which is then kind of admissible in the science spaces. But that does not dismiss the importance of the value that these descriptions bring in augmenting, in improving the understanding of the numbers that we see. So definitely there is appetite. In fact, the solutions that were discussed at COP28 were just published. I'm happy to put the link to that
Please,
in
yeah.
the chat as well, from the Academies of Sciences, where it was published, and we are looking to scale this for COP29.
All right, thank you very much indeed. Ravati Falki from Save the Children, and a long-time advocate for greater attention and support to climate change and health. And also, it sounds like an advocate of health workers who are in communities serving needs where they are most urgent. Back to you, Charlotte. We have 9 minutes left in the session, and then just a point of order. So some people did go and network, but I also know that there's a number of people here who have remarkable experiences to share about uniting to combat neglected tropical diseases. So that'll be starting at the half hour mark. The time may be different from you, so I'm not going to say any one time. And that will be followed by the session on ending malaria together. So really your insights on innovation, equity, and impact. So that is what we're going into. But I know there is, we could spend the entire afternoon with questions like these. How is climate change hurting the health of your community? And remember, our commitment is to give back to you what you shared with us. So every Teach to Reach participant will be receiving, I'm just going to zip through it, this complete compendium organized country by country of the experiences that you shared. It's a remarkable resource, source of inspiration, also source of, let's say, diagnosis to understand what things look like for health workers who are not necessarily climate specialists, but who are seeing, experiencing, and responding to these changes. And that includes local solutions. So Charlotte, who shall we hear from next?
Thank you, Reda. I hope that over the next 8 minutes, we can listen to at least 3 persons. And I'd like to start with Alfred Kipkiri Langat, who is unmuted. Alfred, over to you. And please do start by introducing yourself. Okay, we are not able to hear Alfred, so I'll turn to Gloria Mbanu. Gloria, are you able to speak to us? Please do unmute. Gloria or Sharon Aguti. Okay, Sharon, over to you.
All right, here's Gloria, actually.
Thank you so much.
Gloria is here.
All right.
Can you hear me?
Gloria, over to you, and then we'll go to Sharon next, please.
Yep.
Is all right. Good afternoon, everyone. My name is Gloria Mbanu E. I am a lecturer and I'm a public health researcher. Yes, I've been working with an organization, Initiative for Infectious Disease Control, on neglected tropical diseases. And while doing my PhD, I've worked with the Federal Ministry of Health in Delta State on lymphatic filariasis. And so many things like strategies have been done to eliminate lymphatic filariasis, which is caused by Wuchereria bancrofti, microfilaria, and the vector is mosquito. So Nigeria has been able to distribute ivermectin and albendazole to curb these diseases in various parts of the country, also in Delta State. But unfortunately, while doing my research work, we found that morbidity management, disability prevention, which is also a second pillar of the process of eliminating or disrupting the interruption of this Wuchereria bankruptcy, has not been captured, or there is no data on the morbidity management disability prevention in this Delta state. So which has been a cause of probably also, which has been a cause of also making this disease to spread. But when I get back to Imo State where I live, I ran into a man who is in his probably late 50s that had hydrocele, which is one of the disease, which is one of the morbidities caused by this lymphatic filariasis. So hydrocele, but let me delve into this elephantiasis. It happens that this man has been living in the village over years, and probably that was when he had this the bite of this mosquito, which is infected, which has the larva, the microfilaria, and then which transmitted the Wuchereria bankruptcy into his bloodstream. So this is why he has been growing with this disease, and probably had this what's it called? This hydrocele, but didn't realize that this hydrocele was caused by the vector, or caused by this mosquito that also transmits malaria. Somebody, let me just digress a little. Somebody was talking about Chagas disease, that Chagas disease is being transmitted by mosquito. No. Chagas disease is being transmitted by triatomine bugs. These bugs feed in the daytime, not in the night, compared to vectors of malaria, vectors of lymphatic filariasis that transmits or that bites in the night when trying to pick blood samples. So the Chagas is not being transmitted by mosquito vector. No, it's being transmitted by triatomine bugs. So please, which causes Chagas disease? So please, let me continue with what I was saying.
Yes,
so
and we're going to have to ask you to be very concise, because we have 3 minutes, and I believe Charlotte said there were 2 other people who are also hoping to share their experience. Please focus on what things you actually did, observed, and what happened and how it turned out. But we appreciate your expertise, and I can see questions already, and we'll remember that the NTD session is next as well. So please conclude.
Okay, so this guy has this hydrocele, but has been able to give birth to his children with this hydrocele. But unfortunately, because of stigmatization and the pains that he feels, now feels like going to do some surgery outside the country. So he went out to do the surgery. Unfortunately, the surgery did not go down well with him. He came back thinking that the water in the lymphatic vessels that block the lymphatic vessels has been drained, but unfortunately it was not drained. So he was still combating with the pains and everything, and also had to go back to another surgery, the second surgery, which is now helping him. And this surgery was done in Nigeria now. So, but the point I'm trying to make is that no much information has been done in communities or in Nigeria to get data on the number of people that lives with hydrocele. So the people that live with hydrocele tend to shy away from going to hospitals, and probably when they go to hospitals, they would be stigmatized. You understand? So what I'm trying to say is that if we can help people now go into the communities and tell them that hydrocele, yes, is real, but then you can't be shying away from it, because when you shy away from it, you will tend to probably die out of it, or something else more than that could happen. And these people now they wouldn't have food to eat. They wouldn't have work to do. They wouldn't have anything to do because they are being stigmatized and they are at home. So that is my experience on this hydrocele of ethane. Thank you,
Gloria Mbanu. We hear your expertise and that you're a researcher. We heard the personal story. Joanitor Nasima asks, is it a climate matter? And I think that is a key question for many of the experiences that are being shared. How do we know whether, how climate is involved, how climate change is going to change the disease patterns, the patterns of diseases that you are dealing with, including neglected tropical diseases? This has been quite a session. Remember that we are actually now going into the session dedicated to neglected tropical diseases. So first, we're going to mark a brief pause here. All right, with a bit of a Latin vibe here, and it is now 12:30 p.m. in Geneva. Right, a warm welcome to this Teach to Reach plenary session on the health impact for local communities. We're going to be deep diving into climate in relation to neglected tropical diseases. Now, this does not exclude that some of the Teach to Reach attendees will share stories that are first about neglected tropical diseases, but we'll still ask you the question about climate and its impact. We're proud to be presenting this session in partnership and with the support of Uniting to Combat Neglected Tropical Diseases, which is our partner. We met last week, or actually 2 weeks ago now, with Toko Elfikpuli, who is the Chief Executive Officer of Uniting to Combat Neglected Tropical Diseases. Here's what she said about partnering with you health professionals participating in Teach to Reach. When she says partnering with Teach to Reach, it opens up a vital channel for us to hear directly from you, from frontline health workers, about the challenges you face and the solutions you are pioneering. Your experiences must guide our collective efforts to beat NTDs in a changing climate and achieve health equity. And you can read more on the Uniting to Combat NTDs website on why and how we've partnered to really try to amplify the voices of you, participants and attendees in Teach to Reach health workers, but also we've heard a number of researchers, educators concerned by these issues. So we'd like to kick off now this session. The very simple prompt: think about one neglected tropical disease that affects your community. Tell us about a time when you tried to help people with this disease. What was the situation? Who was most affected and why? And what did you do to help? We're going to lower all attendees' hands as this is a new plenary session. I also want to acknowledge the many messages in the chat already dealing with climate change, which was in the previous session. Unfortunately, we won't be able to get to all of these, but we're looking forward to this, your contributions on neglected tropical diseases in relation to health. Charlotte, do we have any hands raised? Okay, I see already. Yes. And so please be specific. Again, we're looking for your personal experience, not general considerations or your opinion about these diseases or how bad they are, but about really a time, a situation when you did something. Tell us about the situation and tell us what you did and how it turned out. So let's go back to Joanitor Nasima, whom we heard in the climate and health session, and then also from the immunization side of the house, Ndayo Iwat, if you have a contribution specific to a neglected tropical disease that affects your community. Ndayo, we haven't, Joanitor has not responded, so please go ahead.
Thank you, Reda. Thank you, everybody else. Yes, Dr. Ndayo Iwat, I'm in a Federal Capital Territory of Nigeria, and I operate in Kuje Area Council. I'm being specific because of my direct experience with the community, Chibri community in Chibri Ward, in Kuje Area Council of the Federal Capital Territory of Nigeria. We demonstrated an incidence rate of urinary schistosomiasis, bilharziasis, of 9 out of 10 persons in that community, from the village, or the community leader, to the school children in the primary schools. We were able to analyze their urine And I went ahead with my team to do stool culture and microscopy, and we found out they did not have the intestinal schistosomiasis, but they were all having urinary schistosomiasis, that is Schistosoma hematobium. And we also did culture to isolate other secondary infections, and I'm glad to say that not many of them had secondary infections. But terminal hematuria was the presenting symptoms, and it was a chance finding in a primary school when we went to give them health talk on nutrition. And the teacher told us that some of the pupils there were having urine in their blood, and they were taking it as a normal thing for children that are up to 10 years that they are reaching puberty. So having knowledge of what hematobium schistosomiasis is, I had to quickly assemble a team, and we got into the community and we did the screening test for them. And I want to say that they have been taking praziquantel on their own. They will go to the pharmacy shop, they will buy that, and they will take that and feel that they were fine. And some of them did not even have to go for treatment. So when I explained to them the sequelae of this infection, leading to even cancer of the bladder and other chronic inflammatory reactions in the bladder and urinary tract, they were so worried. And I linked it up with the government. We got approval to assemble a multidisciplinary team from the sensitization agency to vector control agency in the water board and the primary healthcare sector, the community. So we got the approval of the minister to put that in place so that we can do vector control, and we can also expand access to potable water to the community, not just with collection to the community, but right to the households, so that householders who are used to going to the stream should be able to have water right in their home and be discouraged from going to the stream. And I was also able to establish that the freshwater snails, there's millennium snails coming from the Lower Usman Dam, that is the major source of water to potable water to the Federal Capital Territory. The environmental impact assessment was not made known. I advocated for that so that they can redo that and let government take full responsibility for what is happening, because we also confirmed that almost all the communities living along the river banks of the fresh water from the dam are having this problem. As I speak to you now, actions have not been taken to address this issue. And I'm looking for partners. I know that the Geneva Learning Foundation has encouraged us to go to websites and look for people that are working in this area. So urinary schistosomiasis is real and is demonstrable in communities in Federal Capital Territory of Nigeria, living along the river banks of Usman Dam, flowing down to the ocean, to the river Niger in the Middle Belt. Thank you so much. I will stop it for now.
Thank you very much indeed, and Iwat, for sharing this very comprehensive and specific experience. Joanitor Nasima has just unmuted a microphone. Please go ahead. Can you tell us which neglected tropical disease you'd like to you have an experience that you'd like to share about? All right, I think Joanitor is still having problems. It sounds like your microphone, maybe there's a wire that's not connected properly. Let's try a few more seconds before we go to Caroline Charles.
Yes, thank you so much.
Unfortunately, Joanitor Nasima, you are breaking up, so I'm going to have to mute you for now. Please see what you can do to fix your connection, and we're going to go to Caroline Charles. Caroline Charles.
Thank you very much.
Don't forget to introduce yourself. Tell us which neglected tropical disease is you'd like to you have an experience with, and then tell us about a time when you tried to help people with this particular disease. But do introduce yourself first.
Okay, thank you very much. So I am Caroline Charles, and I'm based in Abia State, southeast of Nigeria. So just like we are talking about, I picked interest in diabetes and hypertension, and this interest came up when we did a project we called the SSN project that was funded by the Novartis.
Right,
then I was working with society. family health.
Sorry, unless
Yeah.
I'm missing something. So diabetes and hypertension are non-communicable diseases known as NCDs. Here we're talking about neglected tropical disease. So is there a connection to NTDs with you in your experience, or is this a experience unrelated to NTDs, which we're talking about right now?
Okay, sorry, I think so. That's a mix-up then.
Okay, no worries, Caroline. So if you'd like to learn more, and these are neglected diseases, which means that many health professionals do not know about them and do not understand how they are different, say, from non-communicable diseases. What you can do is, I encourage you to go to our partners' website, Uniting to Combat Neglected Tropical Diseases, and you have a disease directory. So NTDs include Malaria or schistosomiasis, Buruli ulcer, Chagas disease, dengue and chikungunya, echinococosis, elephantiasis, foodborne trichomoniasis, guinea worm disease, intestinal worms, leishmaniasis, leprosy, mycetoma, noma, rabies, river blindness or onchocerciasis, scabies, sleeping sickness, snake bites, tennisis, cysticercosis, trachoma, and yaws. So that's the current list of neglected tropical diseases. They should not be confused with non-communicable diseases. Thank you so much for sharing. Joanito or Nasima, have you been able to fix your microphone? We'd love to hear from you. Which neglected tropical disease are you interested in sharing?
And she seems to be connected on two devices, Reda.
Okay. All right, Justine Namuli. All right, Justine is yes, Justine, which neglected tropical disease do you have an experience with?
Rhoda, I think it is a neglected tropical disease that does not even appear on the list, which is mumps. Mumps, whereby we have swelling in the jaw. And it's really painful among children, even the adults, most of them get it. And when they get it in Uganda, we don't really have a real treatment or real cure. So when we first, because of the way we serve the community using telemedicine technology, internet, and digital channels, we have been having conversations with the community health champions on phone. And in Uganda, it reaches a season when the mumps are so rampant. And when they go to the hospitals, there is no real treatment. So we usually treat the causes. We usually treat the signs and symptoms like the pain. So we could give painkillers and something to handle the symptoms as they stay with the disease for some time. And after some time, it cures. So basically, that is what we have been facing. We have not really been giving them the real help. Yeah.
Understood. All right. So I just looked it up. So officially, mumps is not classified as a neglected tropical disease, but there is an argument, as you say, that it's certainly a neglected infectious disease in some cases, and I think this is what you are alluding to. Now, just to ground our discussion in what participants shared ahead of the session, and Joanito still has a problem with a scratchy microphone. If I could ask Maria or Charlotte to mute her. Yeah, thank you. So you can see here, and perhaps it'd be good to check if any of these folks are in the room. So Ndasi Downey Vicky shared a story about Buruli snails in Chisto. Chuchu Chukodake said supported a woman with lymphedema. NTDs, again, the testimonial for Mary Aisi. Charles, Caroline. All right, so yes, indeed, this made it into the NTD, but I think that's a confusion between NCDs and NTDs. There are a lot of acronyms in health. Lucy Oyoma Adebayo here has a testimonial as well, so maybe we can find, and of course we've heard actually from the lightning chat and Duka Ozor's story. Right, Rebecca Bello on FGS. All right, so maybe it looks like these diseases are neglected.
I had my hand up.
Yes.
I will take for
Charlotte,
you.
I'm going to turn back to you because it seems like there's several microphones unmuted. Can you help us sort out? And we are looking specifically for someone who has an experience to share with neglected tropical diseases, which tend to affect the most marginalized communities.
Yes,
and perhaps
I'm
that
one
is
of
why
them.
such experiences are more difficult to surface than, say, on malaria or climate change and health in general. Charlotte, have you found someone who actually shared an experience that is on NTDs, not on something else, that we can call on?
Yeah, I have one to share.
Okay, Margaret, if we can hear from you before we turn to Osigno Akpere.
Thank you very much. Thank you very much, Charlotte, and our chair. Thank you very much once again. This is my second opportunity to talk today. It's very, very, very encouraging. I'm Dr. Margaret Naba Galantambazi, one of your guest speakers today. I'm very happy that I have a chance to share about these neglected tropical diseases. The first time I was talking about malaria and how I shared that communication about the climate change and how it affects in Uganda, a lot of malaria cases. Now, regarding the tropical diseases, neglected tropical diseases, I want to share one line about the intestinal worms. A lot of intestinal worms, especially thread worms and roundworms, affect the under fives in Uganda. And why? Because these children do not really have a lot of, they don't have a lot of knowledge about how to prevent worms into their bodies. For instance, when they eat fruits like mangoes, guavas, they just pick mangoes from down the tree. They just eat without even washing them. Much as we always encourage them to wash the fruits before they eat, especially those which are eaten raw. Of course, as children, when they're hungry, they don't think about looking for water to wash, for example, mango that fell on a tree in a dirty environment. So when they eat them, definitely these worms, they enter their bodies and they're affected already. In Uganda, what we always do when, especially we have like in April and October, when we emphasize a lot about children under 5 immunization and treatment of worms. We give them deworming tablets like mebendazole and albendazole. And also during our immunization sessions, whenever people go for outreaches, they have all under 5. They give them deworming tablets, and this is how we are trying to lessen the cases. Otherwise, there are many, and they are stringent, and we always do health education talks in our patient department on how to deworm children, whether they have or they don't have these worms. We try to prevent them by deworming them routinely. Thank you very much. That's what I wanted to share about the neglected tropical diseases and how to prevent them. Over to you. Thank you very much once again.
All right, thank you. And we still have some.
Thank you so much, Margaret.
Yeah. Go ahead, Charlotte. And
Okay,
we did have.
Yeah,
Charlotte, we did have some very specific questions around community engagement and local solutions. So if you are one of the few, I think, who is here amongst our guests of honor or online listening in, who has actual experience with responding to neglected tropical diseases, if you would like to share an experience on community engagement and local solutions. So this was a time when the community was more involved in prevention, detection, management of an NTD. What helped you involve the community and how did it turn out? So make sure you're referring to neglected tropical disease. On mass drug administration, if you've been involved in what's called an MDA, we're interested in hearing about how confidence in MDAs has changed since the COVID-19 pandemic. And then if you think that NTD services, if you're directly involved in NTD services, so this is part of your work, then we're interested in hearing if you think this could support detection of new emerging diseases. These are the kinds of questions we asked you in the Teach to Reach questions, but we're realizing why these diseases are neglected is because, and there seem to be very few health workers. Everyone knows about malaria, and that's the next session, but these NTDs seem more elusive. Nika, Anwu,
Yes, please.
Which neglected
Thank you
tropical
very-
disease would you like to share your
It is something
experience
I
with?
forgot to mention. Can I mention it now? Thank you. Thank you very much. My name is Dr. Onwa. I'd like to talk about my experience around the community engagement regarding Guinea worm. This was a recent experience from my town in Nso. We do have community meetings, and on a community platform, somebody had gone to investigate a particular village that had reports of illegal mining. And on getting there, he saw the illegal miners and a pool of water. So he was trying to find out what they were doing there. And in discussing with them, they now said there were issues around guinea worm. So that got me, my attention. I said, wow, guinea worm. I thought we had eliminated that. So I reached out to the federal ministry, under the state ministry, and luckily I got somebody who had been on NTD's chairing NTD's desk at the federal, Dr. Emuka, and he now kicked off the surveillance team at the state level. So when they went to the village to investigate, they were not allowed to. They had to go and see the traditional ruler and call the community together. They said yes, but there's illegal mining. It's an insecure place, and there was need to also have that discussion with illegal miners to see whether the people would be allowed to go and investigate. So they gave them an appointment for about 2 weeks, and then 2 weeks after they went there, and they were allowed to interview people, get the villagers together, call the community together. And after the investigation, as God would have it, it was not guinea worm. There were leeches in the water. And you have women fetching water from there. Old women were still going in there, and they had so much of that. So the report that was sent back to me was that they saw a lot of, filariasis that was there, and there was recommendation for the drugs that would be taken to the local government, to the community. And there was a lot of mass mobilization and education and about the water. And we're now looking at how to have, better water sinking, boreholes, because really we don't have pipe-borne water in most of our communities. As far as illegal mining is still going on, and they've been cancelled about that and the dangers of, the stagnant water that is around there and what it connotes. But luckily, from the investigation from the state surveillance team, it was not guinea worm. That is my experience and how the community was able to look into that, and the community engagement that was involved. It was extensive. Traditional rulers, opinion leaders, and even the illegal miners were involved in that interaction. That's over from me. Thank you. I hope you heard me.
Yes, loud and clear. Thank you very much for sharing that experience. I suggest, Charlotte, we actually go to Jacqueline Iduso, who said that she's involved in an MDA campaign in northern Uganda, which eliminated onchocerciasis using ivermectin. So, and then we can go to Pamela and Jeru, who we've already heard from as a guest of honor. Jacqueline Iduso, please introduce yourself. Tell us what you do, how you work for health, and where in Uganda, and then tell us which neglect. Well, you've told us which neglect. Yes, go ahead.
Yeah, good afternoon in Uganda. It's afternoon at the moment. My name is Jacqueline Iduso. I'm a pharmacist by training. And I've worked with a manufacturer who actually donated the treatment for onchocerciasis for as long as humanity needs it. And this dated back to 35 years ago. And that was MSD or Merck Sharp and Dohme. So there was a big and bold campaign by Merck 35 years ago, which identified the need to eliminate onchocerciasis as a neglected tropical disease in the whole world and in communities that are affected by, the simian fly that causes onchocerciasis. So this drug was donated to all the countries that need it for as long as they need it. And in Uganda, we have had the drug now for 30 years. But an issue was identified in northern Uganda, where in the riverine areas where this fly breeds, there was a need to have that community covered in terms of having chemotherapy for this drug. So they basically gave drug therapy, which was a mass drug administration campaign throughout the riverine areas in northern Uganda where this simian fly breeds. So that entire community was covered by 1 tablet of ivermectin And that mass drug administration was championed by the president of the country, who realized what the problem was. So the president was available and on hand, and he officiated at the mass drug administration campaign, and that whole community was covered. And I'm glad to report that 10 years later, after that MDA was initiated, there is no more onchocerciasis in Uganda, and this was declared by WHO. So it's a very big and bold campaign that has been successful in Uganda, and I would encourage other communities that have this kind of challenge to glean from some of the experiences of the countries that have managed to eliminate this kind of debilitating disease that causes river blindness and severe scarring of tissues, of soft tissues of the skin. So I'm just kindly requesting that if in this Teach to Reach we can reach other countries that have onchocerciasis, then an MDA approach would do well to eliminate that disease in their communities. Thank you.
Thank you very much indeed. The prospect of eradicating a disease, especially a neglected tropical one, is, I think, a story absolutely worth telling. Charlotte, we have a number, so we have 5 minutes left in this session. Let me just go check the schedule here. And if we can mute, if I can ask Maria to mute whoever's microphone is scratchy. We will be at the top of the hour. We'll be going into the next session, which will focus on ending malaria together. So there we're really looking forward to health worker insights on innovation, equity, and impact. And that is what we'll be doing 5 minutes from now. So I believe, Charlotte, we may have time for one person, maybe two, if both are concise, before we go into the discussion on malaria.
Definitely, Reda. I was asking Pamela Njeru, who was unmuted earlier on. And please do check your microphone, ensure it's working well, it's not scratchy before you raise your hand and unmute yourself. Pamela, are you able to unmute very quickly? Okay.
Yeah. Okay, thank you very much. Pamela Njeru from Kenya. And I'm happy to be in this forum today to discuss about the neglected diseases in Kenya, whereby one of them is rabies. Recently, we have had an outbreak of rabies, whereby the community do not know or understand what is rabies. Even some cows around the community had rabies because they were bitten by the dogs that had rabies. And some of the people around there were slaughtering the cows. And that was a problem in the community, whereby I raised an alarm about the situation in the community, in the county government where I belong, because in Kenya, we have counties. We have the national government and we have counties. As a champion around that community, I discussed the issue with the people that deal with that problem. And we had to organize how to have a training of champions in that community so that we can deal the situation in my area. So we had a training of around 5 days, trained around 50 people who are going around the community, training the people in the community about rabies and how the symptoms of rabies, how to deal with an infected dog or cow or person, because most of them do not know all the symptoms of rabies. And now we are still in the process where I'm also involved so much. I go around the community, checking around the dogs, checking the cows in the people in the community, getting information if there is something not normal in the community that is happening to people, and also the people in the community, the dogs, whatever that may, even the goats, if they are bitten by the dogs with rabies. And we are trying now to see what can we do to reduce this pandemic that has come in my area. Rabies has been in my community, but not as much as now. And in Kenya also, it's nothing that people discuss about rabies. Even the injection for rabies is rare. So if a patient a person is bitten by a dog that has rabies, he or she is likely to die because even the injection is very far and very expensive. So I'm involved in that campaign, and that's why I felt it's good that I share where I am involved about rabies. And I hope maybe by the end of this year, we will have sensitized the community. The government would have taken up I'm advocating also for the government to bring the vaccination or the injections around the facilities we are near the community, so that we don't risk losing people. And also the veterinarians to be around to sort out the problems of the community with the cows and goats that are being affected with rabies. So that is what I wanted to share with this great team.
All right, thank you very much indeed. This was a challenging session. You can hear neglected tropical diseases in partnership with Uniting to Combat Neglected Tropical Diseases. Thank you again. If this leaves you thirsting for more, if in particular, if you were not able to share the experience that you have with a specific neglected tropical disease, if you have questions about NTDs, we urge you to do two things. One is go to the Uniting to Combat NTDs website. This is where you can check, is what I'm concerned about a neglected tropical disease or not? That's the first checkpoint, and then you can learn more about them. Second is you to go into the networking, because there in networking you'll be able to share your stories for Ernest Boateng, or for Gifty, or Iya Abdul Kadir, who had very specific experiences to share. I urge you to go to the networking. Again, it's very simple. You click on networking on the Ring Central Teach to Reach Connect 10 platform. Click on join now, and then click on join, and that will match you up with someone else in the session. Now, though, we are going to go to the discuss and share experiences around malaria. So for this session, we're going to kick off now with this. All right. Warm welcome to you. Teach to Reach 10. This is a session many of you have been waiting for. We've received literally hundreds of experiences that Teach to Reach participants have shared back around their experience of the fight to end malaria, to roll back malaria. And you can see here with us in our Zoom studio are those we call guests of honor. And they are those who have shared their experiences specifically around malaria. I realize we've just finished a session on neglected tropical diseases, and now we are receiving messages from those who were ready to share. We are going to do much more on these two issues, we hope, with our partners, current and future partners around these two issues. So if this leaves you thirsting for more, next time you receive an email from Teach to Reach that mentions malaria and neglected tropical diseases, don't miss it, don't set it aside, but follow up on the prompt. And so here, we know this is an issue that cuts across everyone in malaria endemic countries. And so we wanted to start with this first question. How has malaria impacted your life, your family, and your community? So we're going to lower all the hands and open up for this question, Charlotte. And we know this is not necessarily an easy question. Over to you.
Thank you, Reda. So I'll be keeping my eyes on the chat. If you want to share a story or answer the specific question on malaria, you indicate in the chat and we'll turn to you. So we're going to start with Rashida Musa. Rashida, are you able to unmute? I am inviting you to unmute. You also have Bernard.
Hello, everyone.
Yes. Hello. Over to you, Rashida. And please
Hello,
just start by introducing.
Okay, hello everyone. Good afternoon. I'm Rashida Musa Mukaddas from Bauchi, State of Nigeria. I would like to share my experience on malaria. Actually, malaria has impacted a lot on my family, myself, and my children too, as well as my community. We suffer a lot of malaria. For over the few months ago, we have been suffering from malaria issues because we have been taking, I encourage my family to access care from the facility, and most of the drugs given were not being able to treat those kind of diseases, unless we took a longer period before it was cured. And now I encourage my family to be sleeping inside a mosquito net. And my majority of my family were leaving their water just like that. They are taking a highborn water that is infected with a lot of vectors and a lot of issues that causes malaria. Like also, due to a lot of symptoms, we know during this period, we have been experiencing a lot of harsh weather. The weather is not so good so that is why a lot of my family, my children have suffered the most. And actually, from my child experienced some kind of measles last month, and he started with malaria, which stayed longer for a period of 2 to 3 weeks without having a proper care until after some few time the measles just start to come out, even though he has taken his vaccine and other things. That's why it has not affected him the most. So from there, we encourage my family, my community to take care of themselves. Whenever they want to sleep, they should sleep in a conducive environment, and they should sleep in a place where there is not affected with mosquitoes. Even with mosquitoes, they should be able to fumigate the environment with something that will, with the kind of fumigation insecticide that will that will kill and reduce the number of mosquitoes around that environment. Actually, we worked in WCY, the Women, Child, Youth, Health and Education Initiative. We encourage the communities. We give a campaign to the community for proper taking good care of themselves, not to sleep without mosquito net, even though Nigeria has stopped sharing free mosquito nets. Then when there is a free mosquito net that used to be given to pregnant women, they usually sleep inside mosquito. Now that we have lack of adequate mosquitoes in the facilities. Majority of the community have issues of funding, issue of economic crisis now, that they are suffering from providing food for their family, talk less of to think of purchasing or buying mosquitoes for them to sleep inside it. So all these
Reda, you'd like
Yep,
us,
we just
Rashida?
lost Rashida, but I think we understood the point. Again, we encourage you. We know this can be very personal, that you and your family may be affected. It's also, as a health worker, the work that you do. And of course, we're interested in both. Why are we interested? Because by sharing specific experiences, and we had some very specific questions in the Teach to Reach questions. One of them, of course, is how changes in climate and adverse weather are affecting malaria in your community. And really the key question is, what actions have you or others taken? How do these actions make a difference? Another question we had is about the utilization of bed nets that is low in some communities. What's the situation in your community? How are bed nets available? What makes a difference between a family that uses bed nets and a family that does not? If you have the chance to ask for support, so for anything other than funding, other than money from your country's most senior leaders, so your president, your prime minister, the government, what would you ask for and why when it comes to the fight against malaria? And if you are involved in your country's malaria vaccine introduction, can you think of a time when you helped an individual or a group gain confidence about malaria vaccine? So under this very broad question, we have far more specific ones. Again, this is a session that is intended to leave you thirsting for more. Isn't that right, Charlotte? Because it is very short, but we do want to hear a few voices, and we'll be following up with more, we hope, some very great and exciting news about what we'll be doing in the future at Teach to Reach around malaria. Back to you.
Definitely, Reda. So I'm handing over to Farm Bernard Badu Bediaku, who is already unmuted. Over to you, Mrs. Bernard.
Thank you very much, Charlotte. Please, my name is Fam Bernard Bedu-Bediako. I'm a public health specialist and a district director of health services at Amansia West District in the Ashanti region of Ghana. Amansia West District is one of the 6 deprived districts in the Ashanti region of Ghana, and it's a mining community. Our road networks are bad, and then mining, illegal mining, as well as legal mining, it's one of the activities that goes on in our district. Now, when you look at our OPD morbidities, malaria is always the number one when you take the top 10 outpatient department morbidities across the 17 health facilities that I have under me. If you look at 2022, for instance, malaria represented 39.8% of total OPD in 2022. But in 2023, at the end of the year, it had gone up to 40% of all OPD cases. And of course, the population has increased, but it doesn't necessarily mean that malaria cases should also go up. Now, if you look at children under 5 years, malaria increased from 4,344 cases in 2022 to 4,548 in 2023. Likewise, for children and adults above 5 years, it's increased from 12,808 cases in 2022 to 14,096 in 2023. And this is a challenge for us. We realize that these are some of the causes. Then I'll come to the interventions that and adaptations that we made. So obviously malaria is endemic and perennial in Ghana. Now the illegal mining activities that go on leave us with open mining pits, which become reservoirs for fresh rainwater, which also serves as breeding sites for malaria parasites, infected female Anopheles mosquitoes. Now, so we've realized that, again, in addition to the open mining pits, there are also insanitary conditions and bushing environments at some of our areas. Now, you would also realize that some of our pregnant women and nursing mothers, children and adults alike, some do not feel comfortable sleeping under the long-lasting insecticide-treated nets, which we commonly call mosquito nets. Again, some individuals on treatment do not complete their 3-day anti-malaria therapy using the ACTs. Individuals also stay deep into the night. And so even before they go and sleep under the nets, they have already been bitten by the mosquitoes. And then some also resort to herbal medications for the management of malaria. However, we know that some of the medications are very good, but others too are not as effective as is being advertised. So these are some of the adaptations or interventions that we introduced as a directorate together with my team and then also the health facility staff at the health facilities. Now, we had to do continuous high impact stakeholder engagement on the rise of malaria cases. So anytime I have the opportunity to meet government officials, to meet traditional leaders, to meet the district assembly, and make sure that I present to them the health situation within the district. And then also, when it comes to World Malaria Day, we make sure that we do a lot of advocacy and get a lot of involvement in the management of malaria. And then also, we've also instituted serious health education and promotion activities within our communities. So we organize debates, we use the community information centers, and radio stations, churches, and mosques to talk about malaria and its effects and how we can all contribute to eliminate. Because in Ghana, we are now looking at elimination of malaria. We have moved from control of malaria to elimination of malaria. There is also an ongoing household registration for mass distribution of mosquito nets, and this will happen in July of this year. Per the universal coverage policy of 2 people to 1 net in a given household. We would ensure that we do proper counseling and encourage people to sleep under the nets. Again, there will also be continuous distribution of mosquito nets to pregnant women who register at the antenatal clinic for the first time. We call them registrants. Then there will also be continuous distribution of mosquito nets to children at 18 months of age when they come for child welfare clinics. At our health facilities, we are working towards ensuring 100% testing That's confirmation of malaria before treatment. And then also we track all the cases of all suspected malaria cases. We want to reduce presumptions or presumptive treatments as much as possible. And then we are also ensuring that all health workers who treat patients for malaria case management are trained and their capacity is built in the malaria case management. And we are also ensuring that both prescribers and dispensers provide adequate adherence counseling to clients who are given antimalarials. And then also, we are also ensuring differential testing and diagnosis to rule out febrile illnesses, because it is not every fever that is malaria. And then we are also ensuring that our pregnant women receive at least 3 doses of sulfadoxine pyrimethamine tablets within the period of gestation. And this is a policy called the intermittent preventive treatment of malaria, making sure that we are preventing malaria in the pregnant women. And then also July, which is next month, is always our health month. And so we do a lot of screening, we do a lot of advocacy, communication, and then testing of NCDs, as well as malaria within the communities. So next month is an opportunity for us also to engage the community on malaria prevention. We are also playing jingles on malaria at all our information centers across the 62 communities in Amasia West District. And so it's a community action helping to eliminate malaria within the communities. And so all these jingles are being played, efforts are being made at the community level and at the district level to eliminate malaria in Amasia West. And also we are looking out for support for indoor residual spraying, targeting the vector, of course. So these are some of the interventions that we've put in place. And we are hoping that by the end of this year, 2024, the malaria cases would go down. In fact, as at the first quarter, we have seen signs of reduction in malaria cases. And we are looking out for the second quarter to end, and we will validate our data. And I'm sure by the end of the second quarter, which is June ending, I'm very sure that malaria cases would have reduced significantly. And by the end of December as well, we are expecting that our cases of malaria would go down. And so in Amasia West, we are very much engaging stakeholders when it comes to illegal mining, because we are promoting what we call regulated mining activities.
Yep, Farm Bernard, I believe you've already spoken about that. Remember that this is a short session with many invited guests of honor who've shared their experience. I take note of the high relevance given the progress of Ghana Health Service in moving from control to elimination of malaria. Thank you for your contribution, but we do want to leave a little bit of time for others to share their experience. We're also looking for really what you actually did. Of course, you were speaking as a program manager, and that is very important to hear that voice as well. Coordinating activities of in your area of responsibility, and that's a very comprehensive overview. Thank you for that. Now we are interested in these specific questions around the utilization of bed nets, the chance to ask for support from your country's leaders, and then this question: have you seen malaria cases go up or down, and why? What have you done to adapt to these changes? Back to you, Charlotte.
Thank you, Reda. I was inviting Caroline Akoshile. Caroline, I don't know if you're able to unmute yourself. Okay,
yes,
I
just done that, Charlotte. And Reda, good afternoon from Nigeria. My name is Caroline Akoshile, and I've attended almost all the Teach to Reach sessions. Thank God for that. I'm alive to attend this number 10 or session 10. Yeah, I've seen malaria, and then I want to say kudos to the last speaker who spoke from Ghana. And I think what he has shared with us is like something that should be shared with everybody, or like a very good case scenario that people should follow and then, maybe we'll be able to do something about malaria all over Africa or West Africa. Yes, I've seen malaria cases go up, not down, because even for me myself, I am a grandmother. I catch malaria, and I've seen malaria resistant to drugs these days. That in fact, the last time that I had to treat myself, I had to use when I went to the pharmacist, they had to give me chloroquine-based malaria drug. Those ones that we used to use in the 80s, 70s, in the 1970s. So malaria has actually gone up here in Nigeria due to climate change, due to change in weather, and then when we have stagnant water all around, even the grandchildren every time, coming up with malaria, and the ones in the boarding houses, when they come back, they have malaria. You treat them, they go back to the boarding house, they have malaria. So what we have done to adapt to these changes is that we try to educate people about stagnant water around their houses. And now we know that even with the climate change, some places they have flood that they didn't used to have flood, and these waters will be in puddles that that mosquitoes will have their eggs and so on, and they come into the houses. And then talking about net is not easy to sleep under because it's hot, and most people don't even want to sleep under it. And apart from the fact that it's no longer affordable, we know what is happening all over the world, and especially in our country, everything has gone up as per price. So, the utilization of bed nets is very important. And I remember, I said, my name is Caroline Koshile. I didn't actually introduce myself too much. I retired from UNICEF, and I know that when I was in UNICEF, we had to introduce nets to communities, and we did some significant change, evaluation of the nets and so on, and it was very effective. The community members who use nets and those ones that did not use nets, but then it needs a lot of communication, behavior change activities for people to take up these nets and then use the bed nets. And then you're asking how the bed nets are made available. Mostly, like the last speaker said, when women, young women of reproductive age, when they register in the antenatal, we give them nets. That's in Nigeria here. That's what I know. I'm a retiree now. I'm no longer too active in all those things, but we used to give them nets, and then we advise them to sleep under the nets. And I know that my grandchildren, they sleep under the nets. And then if I have a chance to ask my country most senior leaders, especially in health, I would say they should not stop distributing bed nets, because there is a time that we integrate programs. When you have measles campaign, you have polio campaign, and then you also distribute nets at that time. I will ask them to distribute nets. And then if they distribute bed nets, which is mosquito nets, and not just distribution, they should also go ahead and do behavior change activities on it, because we find out that at times when you distribute nets, people use the nets to go and fish. They don't use it on their beds. So that's what I would say. That's what I have to say for now. Thank you very much for the opportunity that you have given me to say something. And well done, Reda and Charlotte. You are doing a very good work. Thank you very much. Over.
Thank you so much, Caroline. It is indeed you that is doing all the great work. We are just here to facilitate the process.
Thank you.
Okay, Reda, the time is going by so fast.
Yes, indeed. We have 7 minutes left in this session. And again, we want to leave you thirsting for more, because we are working with partners such as Uniting to Combat NTDs, and also we hope in the future malaria partners to really connect the dots from your experiences into action, and into action that can make a difference. So Charlotte, back to you. I think we should have time, and I really like the fact that these are actually quite comprehensive experiences that are being shared. Unfortunately, with 6 minutes left, we're going to have to ask our next experience sharers to be quite concise and to the point.
Okay, Reda, I see Justine Namuli, you're unmuted, but Justine, please, I would like to crave your indulgence so that will permit others who haven't had the opportunity to speak yet to be able to say something. So there is Bwanko Benjamin or Rosemary Adejo Adaji. Rosemary, I see you're unmuted. Let's listen to you. Rosemary, can you hear me?
Yes, I can hear you. Hello,
Okay,
good afternoon, everyone. Yeah, thank you so much, Reda. Thank you, Charlotte, for this opportunity. I must say that malaria has greatly negatively impacted myself, my family, and my community. And then some years back, due to malaria, I lost a pregnancy at 37 weeks. And again, in my community, I particularly reside in the Federal Capital Territory where I work. And then I work in slums. And then slums, most of these slums are densely populated. And then one of the things we tend to observe is that there are drainages, and then there is open defecation, and then poor sanitation practices. And then we did a rapid kind of assessment. We went to about 3 primary healthcare facilities. We did a little research, and then we discovered that most of the cases in the facilities are malaria and then typhoid cases. So this is what we did. We carried out a town hall dialogue with the community leaders of that community to address it. And then we got the community leaders of this community where we work for them to set aside a day for sanitation in their community. Until date, I'm excited to say that the sanitation days are being maintained in these communities where we work. And then we also met with the governments, especially at the local government level, to provide us some mosquito nets, especially for women of childbearing age, and then of children of 0 to 5 years. Since there is high malaria-related morbidity and mortality. So we got some nets, and then we distributed to these persons. And then we also carried out an advocacy visit again to the government to come and clear some of the dumping sites residing right where people, mothers especially, and their children are residing. And I'm happy to say that the government, especially, let me call the name, Kuje Area Council, was magnanimous enough to go and then evacuate this refuse dump from where people are residing. So what we are currently working with the community right now is to get a dedicated site for dumping refuse. So my ask to the government right now, or to the leaders, is that they should provide more mosquito net, treated mosquito nets to women of childbearing age. The truth is, it's the distribution is very low. A lot of women are not having these nets, even when they make demands. And another thing I want to talk about is they should carry out, provide RDTs, rapid tests, where we could carry out tests. And then if there's anybody that is having malaria, the person should also be given drugs. Because the truth is, a lot of persons do not even have money to buy some of these drugs to be able to take care of themselves. And then the next ask I have again is also for the government to also ensure that there is more material, especially in terms of IEC information education in local languages, so that people could also be able to understand that malaria is endemic and it's life-threatening. So I think I will just stop here and then give opportunity to other speakers. Thank you very much.
All right, thank you very much indeed. I know, Charlotte, that I believe none of the speakers who shared experiences spoke to this question: how have changes in climate and adverse weather affected malaria in your community, which it seems like the issues around malaria are already, without even speaking about climate change, so significant that it's actually difficult to get to that aspect of it, even though there are indications that there are potentially significant changes coming. So we must end this session. I'm going to share a couple more of the experiences. I think we already shared this one. The last one will be from Pamela and Jeru. In Kenya, the government is using the community health promoters to sensitize the community on malaria prevention and net distribution. And she says, Pamela, I had malaria some years back that almost ended my life, as well as my child had malaria that almost killed him. The government is working hard to reduce and eradicate malaria. Thank you for sharing. Very personal story, and I know that as a health worker, you are not the only one to have had such an experience in the face of this disease and the vectors that carry it. So again, do not be disappointed if you did not get a chance to speak. This is one moment. It's Teach to Reach 10. As our guests of honor, we will be following up with you. We will be sharing the experiences that you shared in writing, and we'll be inviting you to further special opportunities, and some of them will be reserved, in fact, for our guests of honor. For those of you who are contributing, how do you become a guest of honor? You become a guest of honor by answering one or more questions. So that's it, Charlotte.
And Reda,
yes, go ahead.
I just wanted to add one thing to our guests of honor, that it may be difficult to listen to everyone, but we can read every comment in the chat. So at times, it could just be useful to share your experience in the chat, and it will be showcased on the screen for those who are watching across other media, and also those who are in the room will also learn from it.
Absolutely. All right, so now we go into our next session. The time is 1:30 p.m. in Geneva, Switzerland. All right, we're very pleased to welcome our partner, our Teach to Reach, eHealth Africa, together with EHA Clinics, and we're of course discussing climate change impacts on health as well as immunization. In just 1 hour and a half, we'll be having what I think will be what feels like is going to be an historic session on celebrating the 50th anniversary of the expanded program on immunization with eHealth Africa and EHA Clinics. We're going to discuss empowering health with data-driven local solutions. We're just going to go check the schedule to see, so you can see too where we are at. And this is what we call the partner showcase with eHealth Africa and EHA Clinics. So we're going to explore this potential of digital health solutions to address community health challenges. And we have some distinguished guests. I'm going to turn this time to Maria to pull David Akpan and Abdul Hamid Yahaya into the panel so that they may participate. Yes, okay, and they're already there. All right, wonderful. So we're very pleased to share, to announce and share this partnership with eHealth Africa. We had already quite a lively and exciting lightning chat with David Akpan, who's the Deputy Director at eHealth Africa. We're going to dive right in, as we do, with an introduction. David?
Yeah, thanks, Reda. I hope I'm loud enough.
Yes.
Excellent. So thanks, it's a pleasure being here, and thanks for having us again on this particular edition of Teach to Reach 10. So thank you so much. Just like we've had scheduled and lined up of conversation to make, we're basically going to be showcasing some digital solution that really is going to help empower healthcare workers, because this is what the platform is all about. It's to make and improve the way healthcare workers, very prominent set of people, how they get to offer services, and also make the work more efficiently delivered. So on the call today, I have my colleague, is also a deputy director at eHealth Africa. His name is Abdulhamid Yahya. So he's going to take us through the presentation today in a short while. So over to you, Abdulhamid. Thank you.
All right, Abdulhamid.
Thank you so much, David, and thank you to the TDLF. I think it's a wonderful opportunity to be on this platform. It's quite an honor. It's a little bit noisy where I am, so I'll try to speak loud so that maybe that can overshadow any noise or background sound that you might hear. Yeah, so thank you very much once again. Just like with David has alluded to, so the topic today is to talk about digital solutions that are helping to respond to public health emergencies and also to strengthen health systems. So today we're talking about a specific solution, which is our NOMIS stock and NOMIS deliver or NOMIS suite of applications that has helped over time for us to solve some of the routine immunization challenges we have in Nigeria. So is someone, okay, the slides are already shared. So can we go to the next slide, please?
Yes, we're actually going to do this a little bit differently. Thanks, Maria, for being right on the job. What we're going to do is actually share here. Let me just, if you could stop sharing your screen, and then we'll go right into it. Yeah, great. All right. And Abdulhamid, before we dive into this digital solutions, can you briefly, or perhaps with David, either of you, briefly introduce eHealth Africa for those who do not yet know of your organization, and tell us also why you've chosen to partner for Teach to Reach and what your experience has been so far. Go ahead.
David, I think I'll defer that to you. Yeah.
Yeah, great. Thanks, Reda. I mean, we can't stop talking about eHealth Africa as far as Teach to Reach 10 is concerned. Yeah, so eHealth Africa, it's an international organization. It's a not-profit organization that we proud ourselves around using digital technology to improve public health or health response. That includes even the use of data solution, digital innovation, that cuts across different areas of healthcare. And our work and our program area of focus is around public health emergency management, disease prevention and monitoring, lab systems and diagnostics.
All right, looks like we have a glitch in David's presentation.
Yeah,
unfortunately.
I can take over quickly.
All right,
I can take
go
over
ahead,
quickly,
Abdulhamid.
maybe before it comes back. Yeah, so I think David started at the right point before we lost him. Yeah, we develop or use data-driven or digital solutions to strengthen health systems and also to respond to public health emergencies. So over a decade and a half now that we've been in the space as an INGO, we've been fortunate enough to be involved in a lot of programmatic themes and space. So for health workforce performance supervision, we've been involved since 2013, 2014. For surveillance and tracking, we've been involved to improve the quality and sensitivity of AFP surveillance by healthcare workers. We've also been integral in the eradication of polio through some of the projects that we've done in the past, vaccination tracking system, and some other polio-related programs that we've been involved with in the past. All of this were integral in declaring Nigeria polio-free sometime in a few years back. So we've also done a lot of work on the immunization data platforms. We were involved with the recent COVID-19, where we helped to optimize and even rebuild aspects of the national platform for electronic management of immunization data. That's with the National Primary Healthcare Development Agency. So we were also involved years back at 2015-16, still in immunization, with what was called the VAX track, where we were in Sierra Leone, helping to develop platforms that were used for tracking vaccinations. So medical or healthcare supply management has also been there, which is part of what we're talking about today, of vaccine supply and delivery.
So
we've also been able to work on
Thank
that
you,
as well.
Abdulhamid. We encourage you to look at the eHealth Africa website, and also the reason for introducing eHealth Africa in this plenary session right after these sessions on climate change and health and before the immunization session. If you go to the schedule on the conference website, you'll see that there are actually 2 workshops after this plenary session with eHealth Africa and EHA clinics that are likely to be of interest to many Teach to Reach participants, and not only those from Nigeria. So integration of primary healthcare into vaccination strategies so that is at 2 p.m. Geneva. And then we also have the second session on neglected needs of women's health later in the afternoon, right after the session for the 50 years of the expanded program on immunization. So in order to participate in those workshop sessions, you will need to be connected to Ring Central and to be able to access. I'm actually going to show you where the session will take place. If you go to sessions in Ring Central, you'll see that there is actually a moderated session here to meet eHealth Africa and EHA clinics. That is when, at this scheduled time, we'll be encouraging you to join those workshops later this afternoon to really meet eHealth Africa and learn more about them. But as Maria Manzan, our partnerships coordinator, has indicated, Abdullah Hamid, you do have a digital solution to routine immunization challenges in Nigeria that you are going to present to us in plenary now ahead of the workshops.
Yeah, absolutely. Yeah. So maybe just to dive in quickly, I think maybe 7 minutes is something so that we have time for questions and other discussions. Yep. So like we rightly said, we're just addressing one aspect, one thematic area, which is the immunization challenges. We have a suite of solutions for across different thematic areas. So for digital solutions for immunization challenge, one of the best solution or platform that we would like to showcase today will be the LOMIS, which is our logistics management information suite. So we are all aware that the healthcare logistics supply chain in Nigeria faces a lot of challenges, and we feel that some of these challenges might even impact the achievement of the universal health coverage by 2030. And just to mention a few of these challenges, you have inadequate investments, you have lack of data to assist all decision makers in making informed decision makings regarding vaccine, and then you have lack of end-to-end transparency in the supply chain. So all of this culminated in Nigeria also being high, I think having the highest percentage for zero-dose children globally, which is, like I mentioned earlier, it's partly due to the lack of data, dearth of data. You don't have availability of data for making informed decisions. And that's where our solution comes in very critically. The next slide will show us in more graphical terms what the problem really is. You have 65% of the zero-dose children living in just 6 countries. And out of these 6 countries, you can see on the chart that Nigeria takes a whopping 20% of that. India comes in next, and then all the way down to Ethiopia with 3%. So we thought about in 2014 when we encountered some of these situations firsthand, we thought about building a solution that can help towards eradicating some of these or mitigating some of these issues. And we came up with LOMIS in 2014. And for LOMIS, it's quite simple. You need to track critical healthcare commodities. Focus of the conversation today will be on vaccines, but the solution, the platform is easily adaptable because it's built in a modular form. You can always adapt it to any other critical health commodity, of course. You can use it for blood. It's also a critical health commodity, even though we do have a solution that is more streamlined to that, but LOMIS is easily adaptable to any critical health commodity that you may want to use it for. So it comprises currently of 2 solutions, which we are integrating into one, just to make sure that there are more seamless interaction between the 2 solutions. Next slide. I think here we talk about how it works. You have the LOMIS stock, which is what sits mostly with the average user. It's installed on the mobile device. It's used by the facility managers, and it sends periodic reports on stocks and wastages. And then on the other side, you have the LOMIS Deliver, which is the delivery, which is a solution that addresses the delivery aspect, where it's also equally installed on mobile devices. It's used by delivery personnel, but it provides status of delivery, quantities delivered, and KPI information such as utilization of the products and wastage, and even temperature at which the product of vaccine in this case is being transported. We know that that's always a critical aspect because you need to transport vaccines at the right temperature. So all of this data is aggregated on a dashboard, and this is where the key stakeholders get to see data, which they can use for prompt and informed decision making. So some of the available information will be on the stock side. You can monitor stock levels. You can monitor quantity of products wasted. You can monitor SCCE, which is the cold chain equipment status, number of children immunized, utilization of the vaccines at the health facilities, and the capability to track even other health commodities like I mentioned earlier. Then for the delivery part, you have status and timeliness of deliveries. You can check on-hand stock quantity. You can record actual quantity delivered, and you can also monitor KPIs on vaccine immunization. There's another interesting aspect, which is the reverse logistics, where you can now track wastages. If you take vaccines to the facilities, you can also use the same platform for reverse, where you take wastages back to other necessary areas or accordingly. So that's how some of the features you have with knowledge stock and knowledge deliver. I think the second to the last slide will tell us, the penultimate slide will tell us about the impact, some key results or some kind of nice numbers that we can take a look at. For Sokoto states, these are states in Nigeria, mostly the northern part of the country. For Sokoto states, after implementing NOMIS, we have about over 300 facilities that are currently using NOMIS. We have over 6,000 deliveries that has been done on the platform NOMIS, and then we have over 2 million vaccines that have been delivered. You can see what's most interesting here is the drive down in the stock out rate. 2017, before we implemented the stock out rate was about 61%. After the implementation, by 2021, we're able to drive that down to about 8%. And the story is the same in Zamfara State. It's the same thing. We were able to drive the stock out rate from 49% to 0.5%. Kano State, Bauchi, the same thing in Kano. After implementation of NOMIS, we were able to drive stock out rate from 45% to 1%. And likewise in Bauchi State, we were able to drive stock out rate from 73% all the way to 0.5% as well. The numbers are there, but I think they are similar. Facilities that have adopted NOMIS 100. We have over tens of millions of deliveries, vaccine delivered on the platform, and we have thousands of deliveries that have been made so far. So not to take too much time, I think this should be the last slide I'm going about. So where are we currently with this suite of applications? We currently won the WFP Global Innovation Accelerator Challenge, which NOMIS was actually the application that we submitted, which won that challenge in 2023. And we got a grant to integrate the two NOMIS stock and NOMIS deliver so that we make them one application that is currently ongoing. I think in a few weeks or months, couple of months, that will be done. And then we are working partnered also from our side to integrate AI so that we can trigger deliveries, automated deliveries at the right time. For you to appreciate this, you need to put things in perspective. Most of the areas where we deploy these solutions or platforms have to reach challenging areas, either due to security or probably due to one form of environmental or issue or another. So it's key that if you can automate and get less human intervention as much as possible, that will really be key here. So that's what we're doing so that when thresholds read, when stock levels reach certain threshold, automatically the AI algorithm is going to trigger at a delivery process that doesn't require any manual intervention at all. Then we're also exploring the transition of knowledge to a digital public good, a DPG, because it's so useful. We would like to have this tool into the hands of as many people as possible and also as many use cases as possible. So we have a roadmap for utilization in extended geographies. Currently, it's within the northern part of the country, but we have a roadmap to extend that also beyond that to other states and then probably other countries as well. I think that's all. The conclusion is quite straightforward. It has improved forecasting, it has enhanced stock availability, and then everybody is diving towards achieving the zero stock out, which is the essential target or key metric for this. So I think I'd like to stop there so that there are room for questions, feedbacks, and other conversations that we might have. Thank you very much once again.
All right, wonderful. Thank you very much indeed. Abdullah Hamid Yahaya from eHealth Africa. You are a Teach to Reach partner, and right after this plenary session, going to go to the schedule again. For those of you who have made it to Ring Central, and I am sorry if you did not, you'll see right after this plenary, so at the top of the hour in Geneva, you're invited to join a workshop session inside the Ring Central platform on integration of primary healthcare into vaccination strategies. So this will be with Dr. Omozigo Izedonmwen, Dr. Murtala Jibril, Dr. Mujdat Baba, and we are now going to go to Maria, let's say, and Charlotte to see if there are questions or comments. Of course, we just had a session on malaria that was far too short, so I see most of the messages seem to be about that. Maria, how are you doing? You've been up since the middle of the night in Argentina. You're our partnerships coordinator. You've worked closely with eHealth Africa. First of all, what would you like to say about the two workshops that are coming up? Should Teach to Reach participants attend them? Why or why not?
Oh, definitely. You should come. It's going to be very interesting. All of us discussing. Remember that in the workshops, there's plenty of room for all of us to participate. So eHealth Clinics is going to be talking, but we all get to share our experiences too. So I'm looking forward to that after this great session with Abdul Hamid and David. So there was one question a few seconds ago, but apparently they lowered their hands. But I'm encouraging people to, there you go, Neka Onwu. Let me just bring you so you can ask your question to eHealth Africa.
Yeah, thank you very much, Maria. Thank you, eHealth, and thank you, Yahaya, for that beautiful presentation. I'm Dr. Neka Onwu, retired as a director from National Primary Healthcare Government Agency, and I'm aware of eHealth. So well done. I'm happy to hear about LOMIS. It's almost like the LMIS we were talking about at NPHCDA. Now, we talk about integrated platform. How integrated is this platform? Does it include the private sector and research? You talked about modules, so I believe that your modules were looking at research, but we have a lot of information about research that's out there concerning primary healthcare, and most of the time, it'd be nice to get them integrated into this platform. The next was the maps. I saw that Sokoto and all, but it doesn't give you a disaggregated view of how the vaccines and all the materials are being utilized across the whole state. So that will give you a feedback looking at it and know where we have issues and problems, because all the states are colored. I don't know whether you have a graded view of where your vaccines have reached and how it's being utilized as a feedback mechanism for somebody who's supervising or who wants to know where to target, like the hard to reach. So we're saying that we're doing in Sokoto, we're doing in Zamfara. You don't still get the idea or the feel of where this is getting to. So it'd be nice to see that. Digital public good, I don't know what that means. Other geographies, I don't know what that means, but I'm hoping that it will go the way of an integrated health system platform where you're looking at maternal and child health, starting from the planning area, so that all the resources, how they feed in and how they are supplied, is all pulled into one. So you're maximizing resources and better utility of such a platform. But great thing, eHealth, and nice hearing from you. Just what I was reading from, permit me, because I'm sure the time was short and couldn't delve into it. Well, those are my thoughts as I was listening. Thank you.
Thank you very much indeed. This questions from Neka Onwu, from NPHCDA. Abdullah Hamid Yahaya, would you like to respond to the different, at least some of the issues raised by Neka Onwu?
Retired from NPHCDA.
Retired, apologies. Yes.
Yeah, those were very useful comments. Yeah, I know because of time we might not be able to address all, but it's good to just share some insight on some of them. The integration was a technical integration about the solution. It's not only about the approach. how we're integrating with other communities. No, what I mentioned, integration is rather than have the two solutions, Lomis Deliver and Lomis Stock, working separately, we want to integrate them into one single solution so that data flow can happen more seamlessly across the two solutions. So you will be able to get better insight because it's a single solution rather than have separate solutions. So that's what I meant by integration. Then the disaggregated data, of course, that's you are spot on that. There was no time. We have those maps that have all of the what is called a heat map that shows where troublesome areas and where the deliveries are going on more smoothly, because it even happens real time. The essence of the platform is for you to be able to get real time data as it flows in, as the vaccine is being moved from one place to the other, and as the vaccines are also being administered. So that data actually exists. Maybe because it's a short presentation, we didn't necessarily capture that. We just wanted to show the impact, what has happened before the implementation of LOMIS and what happened after the implementation of LOMIS in certain communities. And for DPG, digital public goods, that's where the software becomes free. It's already open source. We can give out the source code and everything free, so that you don't need to pay for it. Instead of it being proprietary in any way, it's completely free for anyone to use it. So that's what we meant by DPG. Other geographies is our plan to extend to other part of the country and also beyond Nigeria as well. But thank you very much, Nneka, for those wonderful insights.
Thank you very much. Now we have two questions from Teach to Reach participants who are in the main Ring Central place. So it's from this, or actually one question. What is the relationship between zero dose and digital utilization to routine immunization? If you can help us connect the dots from the eHealth Africa perspective, I think that would be helpful.
Yes, I think that's also another wonderful question. The vaccine, because part of the challenge is you can't attain zero dose if at the critical time that the vaccine is required, you do not have the vaccine. If you don't have the information that will tell you when a vaccine will be required, it's going to be difficult. So what Lomis Stock, both this deliver and the stock, which is being combined now, what it does is it gives you that visibility for you to be able to plan ahead of time, that at so time you require a certain number of vaccine for administering in this particular community or in this particular community, I should say. So that insight, that visibility, transparency, visibility that you do have now, or that data allows you to make all of the informed decisions, which will drive stock counts lower and also drives adoption of the vaccines higher, and also helps you to reach the zero dose, because most of the people that are challenged in getting this dosage are usually hard to reach and challenging areas. So that's the from a logistic point of view for these particular solutions. There are other programs and other solutions that address other aspects of the zero dose, but right now I think the conversation here is about the supply chain challenges that we have and how it connects to zero dose. Maybe David, you want to shed more light on that as well, but I think that's the response from my side.
Yeah, I mean, I hope I'm clear now. I think I got cut off. Is my internet better now?
Yeah, we can hear you clearly now.
Oh, excellent. Reda, we were talking about challenge with, closing the digital divide, but I didn't know I'm going to be one of them.
A case in point, yeah.
A case in point, that's right. Yeah, so I think you've really answered that carefully. So to address zero dose, there are different angles to that. So what we presented today is actually the supply chain approach, right? To ensuring you have timely, delivery of vaccines when they are needed. We have another solution which Abdulhamid, talked about it in passing, which is called Plant Field, that helps, with the proper planning of vaccination process, and that deep into even knowing where your coverage area is, the most needed population, how are you going to plan to cover them, what cohort mapping you need to do, how do you deploy the team. That solution deals with that. I don't think we have time to really talk about that. So definitely there's a connection with all of these to addressing zero dose and also optimizing routine immunization to the population that needs them.
All right. Thank you very much indeed. We want to give you time to go to the workshop session. I did want to show the website for eHealth Africa. And of course, we encourage you, Teach to Reach attendees, to check out these partners who are supporting Teach to Reach, supporting your participation in various ways, and sharing the opportunities and the solutions that they provide. So that's the eHealth Africa website. And now I'm going to ask Maria to direct us. We are taking a pause in the plenary, so we're going to be closing down this plenary session for the next hour. And Maria, why is that? What are the two options that people have at this stage as Teach to Reach attendees to stay connected, continue to meet, connect, and learn?
Thank you, Rita. Yes, well, we welcome you in the workshop with integration of primary healthcare into vaccination strategies. That is going to start in 2 minutes.
All right.
And it's with eHealth Africa and EH clinics. Or you can choose to network, which is another option. You go to the networking in your left panel. You can choose the sessions or the networking, and then you will be randomly placed with somebody to meet and learn and share your experiences for a few minutes too.
All right, and I see there are already 6 people in the waiting in the workshop. So let's just go check that out.
Can you hear me?
All right. So obviously the workshop is getting set up. Let me share the link. All right, let me share
Please, I want to share my.
All right, let me share the direct link. I think they probably need you, Maria. They probably need your support in the next few minutes. Let me just share for those of you who are with us in the Zoom studio, and for those of you who are on the stage following this before we shut down the live stream, we're going to share the eHealth Africa workshop link, so you can go directly there. But really, by now, you should be comfortable with navigating with the. Let me just put a pin in that, and then we're going to do a brief recap while participants go off to either network or to attend the eHealth Africa workshop, the first of 2 workshops in addition to this plenary session. We're going to just recap what we did today. There's been a lot happening, and we hope that we're leaving you thirsting for more. All right. So we started the day this morning in Geneva. The time may be very different and very inconvenient depending on where you are in the world. Introducing Teach to Reach Connect. We introduced the Immunization Vaccines Work Collaborative that is being launched by the Nigeria Movement for Immunization Agenda 2030 with the Geneva Learning Foundation, UNICEF, and NPHCDA. We're, of course, going to celebrate in just about an hour the humanly possible 50 years of the expanded program on immunization. So that'll be coming up an hour from now. We, of course, also honored and saluted and thanked our supporters and partners, eHealth Africa, EHA Clinics, but also Uniting to Combat NTDs. We just had an amazing session on NTDs, actually a difficult session in some ways. And I think there are definitely some things to celebrate. We gave you the numbers for this Teach to Reach, looking back to Teach to Reach 6, Teach to Reach 7, Teach to Reach 8, Teach to Reach 9, and today's amazing number, Teach to Reach 10, 21,398 participants registered, over 1,500 experiences shared, and activity across the Teach to Reach network before, during, and after Teach to Reach. We had, of course, during the opening ceremony, a remarkable set of testimonial stories shared by women who deliver vaccines. We highlighted the Women Inspiring Women collection, and then a tangible practical output for immunization workers involved in HPV vaccination efforts. We're about to share with Teach to Reach participants this compendium of experiences and this really kind of handbook and tips from the frontline, from health workers who've actually introduced, scaled up, and sustained HPV vaccination. We collected thousands of experiences, and our Insights team has condensed them down into a short, concise, practical handbook of tips that you can use. And we're working with 32 ministries of health who've expressed interest to determine how we can best disseminate this experiences handbook, these tips, to health workers involved in HPV vaccination. It's the first time we've sort of closed the loop working with the national EPI teams, using knowledge that is grounded in the practical experiences of health workers. So stay with us. We're not done yet. If you haven't left yet for the workshop, for the networking, of course, you can stay connected in Zoom. That's the best way to make sure you don't lose your seat because of how many people are involved today. But we're looking forward to the EPI session. Teach to Reach started with immunization in January 2021, which of course was a very specific moment in the history of immunization when immunization staff all over the world were getting ready to introduce COVID-19 vaccines. So I think that's the recap. We hope you have a great networking or session or workshop. We also want to thank our media partners. DevX is one of 3 media partners together with Gavi's Vaccines Work blog. You can find they're running a series of articles based again on the Teach to Reach experiences shared. And then we also have Health Policy Watch, an independent global health news outfit that has just published a inside view on Teach to Reach 10 with over 21,000 health workers uniting to tackle climate and immunization challenges. That's the recap for this first session. We'll see you in less than an hour after the workshop, after the networking, for the 50 years, celebrating 50 years of the expanded program on immunization. The latest estimate is that of over 154 million lives saved through the efforts of course, global partners, but also health workers on the front lines working side by side with communities. Once again, thank you, and we'll see you very soon.